start this event, and we can listening the opening speech from Dr. Yanuar Iman Santosa. And Dr. Yanuar, time is yours.
Thank you. Bismillahirrahmanirrahim. Good morning to everyone. Our distinguished lecturer, Professor Namita Yoshi. We would like to please give a lot of appreciation because you are here to give us a lecture, especially as a guest lecturer on the topic today regarding sleep language as in your topic in your field, which is as a speech language pathologist. I believe as an ENT surgeon, we will deal a lot of things dealing with speech. So it will be very helpful for surgeon to know another aspect of the patient management. And from the profile, Dr. Mita is a distinguished lecturer from Bharati Vidyapeeth University, and also currently she is a founder of the Sampark A Polyclinic in Pune, India. Correct, Professor?
Yeah.
Which deal with a lot of patients having a difficulty in speech. I think it's very interesting, and I also see that the clinic is a very good clinic, and is also providing not only offline therapy but also an online therapy also, yeah, which is
Yes.
very interesting. Yeah. So we will learn a lot from Professor, and so I appreciate your time here. And also, I would also to appreciate Dr. Kanti for making this morning session happen due to her connection with a lot of lecturers from around the world. So, Professor Namita, thank you for your time, and maybe would like to give opportunity to you to start the lecture for today. Thank you.
Thank you, Dr. Yanur and Dr. Kanti and the distinguished faculty of the university. So let us begin with the topic right away, because the topic is huge and the time slot, though I was telling Dr. Kanti that, give me 3 hours, 4 hours, or, that is not going to be enough, but I'll try my best to cover up the maximum portions in these hours. So I'll share my screen now. Is my voice okay? Just give me a thumbs up if you can hear. Yeah, very clear. And you can see my PPT.
Yes, maybe you slideshow the PPT.
Yeah.
Thank you, Prof.
Yeah, so this is the topic of the online lecture today, role of speech language therapist in voice disorder management. And thank you for the introduction, lovely introduction. But let me just be, a little more, be specific about what is Team Sampark. I am a director of Sampark Polyclinic, and we recently, celebrated our annual day. This is a picture of our annual day, where we have 2 branches. It's an online as well as offline clinic, and it is under one roof. We have multidisciplinary team. So voice disorder management is not only speech language pathology, as you all know. It is also otolaryngology. It is also sometimes, psychiatry and psychology. The team member also include physiotherapist, occupational therapist sometimes, So that is how the team is developed at Sampark Polyclinic, where we have all these therapists under one roof. And we are very proud to have all women team with one research associate expected, with us. Can the microphones be mute, please? Maybe all participants can mute the microphones. Yeah. So this is the branch at Katras in Pune, Maharashtra state, India. And this is the Kothur branch, which is a second branch in Pune, Maharashtra, India. So we have different therapists working under one roof. So what is today's lecture? So I come from a background where we work in multidisciplinary team already. So I'm not sure how many of you are aware of this work in multidisciplinary team. In the classroom, you can just raise your hands of those who have been working in multidisciplinary team, or give me a thumbs up. How many of you work in multidisciplinary team? Just you can raise your hands or tell me, or you can just chat. All of you work in the multidisciplinary team. You work with otolaryngologist, that you all are otolaryngologist, physiotherapist, speech therapist, occupational therapist, psychologist. I think, yeah, maybe most of you are working in a hospital setup, so you have everything under one roof already, right? So in today's lecture, we are going to talk about overview of voice production and voice disorders, which you already know. You all are ENTs, so you know the anatomy better than me. I'm just going to brush through that part in terms of what a speech language pathologist looks into it, okay? Brush up on assessment of voice, acoustic, aerodynamic, perceptual, voice therapy basics, voice therapy specific to functional, neurological, psychological voice disorders, demonstration of these techniques and some videos, and then take home message. This is what we are going to learn from today's lecture. So moving on to the voice production, you all know that respiratory passage is the home for this voice box, the vocal folds, and vocal fold opening and closing happens with respect to 3 dimensions. Okay, so it is happening from anterior to posterior, it is happening from lateral to medial, and it is happening from inferior to superior. 3-dimensional wave like structure is formed when the voice is produced in the voice box or larynx. So this changes throughout the lifespan. So this vocal fold, lengthwise, widthwise, neuroplasticity-wise in the brain is changing throughout your lifespan. So this results in the frequency changes and some mucosal changes throughout the lifespan. So you all know about this, but this is very important when it is coming to therapy. Okay, why? Because we have different approaches for age children below 10 or 14. We have different approaches for middle age, the adult male and females, and we have little differences in the approaches for the aged population, where the frequency is slightly getting, the voice is slightly getting breathier and little high frequency as compared to what it was earlier. Okay, so we have to remember the age, and we also have to remember the fundamental frequency in mind when we are starting off the therapy. Okay, so just let us look at acoustical correlates of these kind of fundamental frequency changes. You can see that the pulse register, that is the low frequency, okay, sometimes some males have this kind of low frequency and the intensity varies in these particular frequencies. The model register, that is the middle frequency register, where most of the male and female in our adult lifespan or even childhood, infancy to the old age lifespan, we range around model frequency, range in fundamental frequency. And the loft frequency is again, some of the males and females lie under this, depending on certain situations, whether they're singers or actors or theater actors. Okay, so aerodynamic correlates of pulse register, the airflow between the lungs and the vocal output is very low in terms of pulse register. So when you have to reduce the pitch, you have to let a lot of air go out. Okay, and the subglottal pressure is higher when it compares to producing the pulse register. Model register, the airflow is moderate to high and slightly low to high subglottal pressure. Okay, so you have to remember this when you are treating a patient. When you want to change the frequency of the patient, like fundamental frequency, for example, in a patient with hoarseness or breathiness, usually the fundamental frequency will reduce. Okay, and we need to work upon the closure of the vocal fold and increase in the fundamental frequency. So we have to remember this aerodynamic correlates like where the airflow is high, where the subglottal pressure is high, so that we can correlate these findings with the physiological characteristics of the voice. Okay. So another physiological correlates would be in pulse register, vocal folds are short. So they are usually bowed in terms of old age people. That's why the vocal fold shortens and becomes bulkier or thicker. Okay, so vocal fold, true vocal fold is thicker when the pitch reduces. Okay, remember that. And then vibratory pattern is very short pulses, long time to be taken for one wave to happen. Okay, so short opening time and very probably prolonged closure time is available. Sorry, prolonged opening time and very short closure time is available in pulse register. In model register, it is longer, thinner pulse register, and it is longer than pulse register, but it is not longest, but it is longer than pulse register, and open time is longer, and overall the vibratory pattern is short close time. Okay, again in the loft register, long and thin vocal folds. In loft register, most of the time the vocal fold is not completely closed. Okay, so low amplitude for open and close time, so both the opening time and closing time are very low. Okay, next we are moving on to the mucosal wave. As respect to, as an SLP, I'm more interested in the mucosal wave, and the anatomical pathological part the otolaryngologist definitely takes care. But if you just see that I look into mucosal wave in 3 dimensions, that is inferior to superior, anterior to posterior, and lateral to medial. The 3 dimensions I look into, and I decide whether the therapy is required for prolonged time, whether the therapy is required for just few months, or whether the therapy is required for few days. So depending on whether it is unilateral vocal fold palsy or bilateral or superior laryngeal palsy, depending on how much is the closure. Okay, is it a wide full closure, is it completely closed, or is it the hypertrophy, is it the bowed vocal fold, or is there anything on the vocal fold like little hemorrhagic patches, or posterior side is affected. So depending on all that, we'll look into the CSL data, we see the CSL parameters, and then we decide about the way of doing the therapy, which you all are going to learn today. Okay, so you all know about classification of voice disorders, that is phonotrauma, organic disorders, functional disorders, psychogenic disorders, and neurological disorders. So out of these disorders, which of the disorders we can treat very successfully in therapy, or which of the disorders need a lot of medical attention and very less of voice therapy, which of the disorders require pre versus post voice therapy. Some of the disorders like phonotrauma, where you have the abuse and misuse of the vocal fold, here you require a pre-therapy as well before doing the medical intervention, or if there is any medical intervention required, you also require the post-therapy. So even in cases with muscle tension dysphonia, you first give a try to your voice therapist or SLP over there. First ask her to, ask him or her to do some therapy for 2 weeks or 3 weeks, and if you think that the therapy is working, only then you do not intervene in the medical intervention very early. So depending on what type of disorder, it is very important to decide the type and then look into the therapy progress or prognosis and how long the therapy is required. Okay, definitely in terms of neurological cases, medical intervention is a major step, and speech language pathologist or a voice therapy is secondary. And psychogenic disorders, there is high chance of patients developing. So depending on these voice, whether it is organic, whether it is functional, whether it is non-organic, so these are the different types of disorders which you will see in your day-to-day OPD basis, like dysphonia, aphonia, different types of inflammatory diseases, if different types of minimal associated pathological lesions, and accompanied neuropsychiatric ailments. So different types of voice disorders. So I would say, as a speech language pathologist and voice therapist, I definitely would recommend voice therapy for minimal associated pathological conditions first, okay? Then the non-organic conditions, then the accompanied neuropsychiatric conditions, and lastly, organic and congenital conditions. So success rate of voice therapy works in a reverse order. It is very minimal in terms of organic and congenital disorder. It is next maybe 30 to 40% in accompanied neuropsychiatric disorders like spasmodic dysphonia and supralaryngeal palsies. If it is unilateral palsy, we can still hope for very good success. But if it is a bilateral palsy, then we do not look into voice therapy. We directly go for medical intervention. Organic, non-organic conditions, the progress is very good. You can say 70%. And for minimum associated pathological conditions, the success rate can be even above 95%. So it depends on where the problem lies, whether the problem is in filtering the voice, which is in the oral cavity, whether the problem is in the source, that is the larynx, or whether the problem is in the power, okay, that is the breath supply. So as a voice therapist, we will work in 3 different conditions, okay? So I will work on filter, I will work on source, and I will work on power. So these 3 keys, these are the key factors of voice therapy, okay? Moving on to the next. So the success depends on what all. So how can we be sure that in this particular patient with minimal associated anatomical issues, we can be successful? So it depends on impact on the vocal fold, how much is mucosal wave affected, how much is the size of the polyp or cyst, or how much the mucosal wave is affected in anterior side versus posterior side, symmetry of the mucosal wave, whether it is able to come equally to the center, like how much is the symmetry from left side and right side. We look into the width of the vocal fold, the periodicity, whether the vocal fold is coming in between very irregularly or it is coming in between periodically. So it is going away and coming in the center at the same time, okay? So periodicity. Then vocal fold, obviously closure. How much vocal fold is good for, closure is good for particular patient depends. Depends on what? It depends on the registers I showed you earlier. Okay, pulse register, model register, and the loft register. So I might have maximum use of my frequency in, say, model register. Most of us, 90%, we use model register for the day-to-day life. But suppose I am a singer and I am an opera singer. So when I'm an opera singer, I will use loft register also equally to the model register. So then should I have vocal fold closure equal to any normal human being or a female of my age who is housewife? No. So my vocal fold closure will be reduced because for the opera singing, I need to have this posterior chink open, right? Because the high frequency demands lot of air pressure and airflow, right? So this depends. That is why the case history is very important in terms of voice therapy, okay? You need to know these minor details about the patient, whether the patient, what profession does the patient do, whether the patient has any secondary profession. I might be just a bathroom singer, but I might be singing like 3 hours a day. You don't even know that. And I might not be a professional singer. But then in that case, compared to a normal housewife, my loft register usage will be more in a daytime. So when you ask about vocal load, how much do you talk in a day? You have to ask about, do you sing? Do you speak loudly? Do you have requirement of increase in the loudness? Okay, you have to ask this question specifically to the patient. Next is client motivation, sincerity of the exercises. So as a voice therapist, I may give you 10 exercises to do daily, but are you doing it Are you really doing it at home? That matters. And if the patient is not sincere, then definitely it will not help. How much ever good you are as a therapist, but the patient is not doing at home. He might be just sticking the chart for you and sending it that, yes, I've done it. But as a doctor or a speech therapist or a voice therapist, your ears should be trained enough to identify whether the patient has done the exercises. So you should know exactly what happens with this exercise to your voice. Suppose I'm giving you B breathing exercise. What is going to happen to your vocal fold after that exercise? So if you have heard that, you will immediately know that this patient has not done exercise at home. Okay, so now being in voice therapy field for last 20 years, I can know just by listening whether my patient has done those exercises at home and how much number of time I have told him to do so. Suppose I've told him 10 repetitions and he has done just 2 repetitions, I will know that by just listening, okay? So client motivation, at the same time, proper therapist knowledge is also required, because if you have this knowledge, only then you will be able to make out, right? And then, sorry, age and gender, overall health of the client. So as I showed you earlier, that age matters. So if I'm giving B breathing to a 60-year-old gentleman versus I'm giving B breathing to a 20-year-old gentleman, the voice effects of both the exercises will be different because of age. Okay, so you should know that age matters, right? And overall health, suppose I have diabetes, I have blood pressure, cholesterol, or I have any kidney disease, or I have other medications going on, those medications can also have some effect. For example, Parkinson's disease, they have L-DOPA medicines, you all know about it. So L-DOPA actually affects your voice, okay? So when I take the medicine at 8 a.m., I'm not supposed to do exercise at 8:30 a.m. because my voice will be worst in that hour. I should do the exercise just before my next medication time. Suppose my medication is 4 times a day, quarter L-DOPA tablet, then 8, 12, 4, and 8 are my timings. Then the best time to use my vocal fold or voice or speech would be 11 a.m., 7 a.m., 3 p.m., and 7 p.m., just before taking medication. Because that medication is the reason that the speech is more stuttered or the voice is more breathier, okay? So you should know the age, overall health, the medication effects, planning and execution of the treatment. So you should be very crisp and clear in telling the patient about how many times you should do these repetitions, what time of the day you should do the repetitions. So sometimes, for example, in spasmodic dysphonia patients, the voice is better as soon as they get up. So the exercises would not help in the morning time because their voice is already good. So when would you give exercise to the spasmodic dysphonia patient? In the evening, because their voice worsens during the day. So you should know when to give exercise also, right? So age, time of the repetition of the exercise, overall health, execution and planning. What plan are you giving to your patient? All that also matters when you are thinking about success or prognosis, okay? And there are some conditions like relapse, okay? So relapse conditions, or like earlier point I missed, measuring improvement. Measuring improvement is something like whether I give a B breathing exercise to a client and his earlier breathing time in one breath is suppose say 5 seconds or 8 seconds. So is he improving on this number of seconds in one breath over a period of time? Okay. So I give you exercise and today your one breath phonation time is 8 seconds. Have you improved it in the next visit to 10 seconds? If you have improved, then therapy is working. If you have not, then therapy might not be working for you. So that is how we make those decisions. So the last point here is relapse. Relapse in certain conditions. For example, patients who you have given Botox injection After the Botox injection impact is gone, the patient might again feel the breathiness and hoarseness in the voice when the second Botox turn comes to him, like say after 6 months, okay, or 1 year, depending on the patient. So you should make the patient aware about these relapses. For example, even in the cases with vocal nodules, even in the cases with vocal polyps, they may recur, okay? So depends on my vocal abuse and my vocal habits. It may recur in say 3 months time, it may recur in 1 month's time, depending on how I am following the program or plan given by my therapist. So you should make patient aware that these conditions might recur and you should be careful, okay? So success depends on all this. So success is not just you becoming good voice therapist, okay? Success depends on a lot more factors, and that you should make the client aware in the first session. You should tell the client, if I give you exercises, you should do it sincerely. If I give you exercises, it may not work. So it is a trial period. So we have to do this to see whether medical intervention is mandatory for you. We will try this out. If it works, fine. Otherwise, you go for medical intervention. Planning and execution should be written down like a table format, like a checklist format to the patient in his file, so that he follows it and brings back that report for you, because it is very important. All right. So just like starting up now, where the patient comes to your OPD and you have this process of voice evaluation where you undergo case history. I just told you a few points which are very, very important in the case history: his diet, his daily routine, his profession, his age and other medical conditions and history, his medication, his also time of the diet. Like for example, if I'm eating, because of my profession, I'm eating morning 8 a.m. and I'm not eating till 4 p.m., which most of the doctors do, by the way. So apart from that, so if you're eating like that, then that's not going to sustain your voice quality for longer, okay? So you have to ask this, how long is the gap in your meal? So you have to have a dietitian in your team, okay? You have to have dietitian in your team, because nowadays in current era, diet and gut health causing more voice issues than vocal abuse and misuse, okay? So gut health is the most prominent factor which is causing voice issues. Let me just drink some water. Okay. So assessing quality of life and voice outcomes is very, very important. Perceptual evaluation. First thing, listen to the patient, whatever he's saying. Okay. Don't ask him questions in the history right away. First take the recording. So when patient comes to me, I do first 10 minutes of just verbatim recording, like, tell me about your problem. So I go on like, okay, more. Okay, tell me more. Okay, tell me more. So sometimes you don't need to ask so many questions in the case history, because some patients are so thorough with their problems. So one of my patient was a housewife. She came to me saying that nobody understands my voice problem. I have been to 10 doctors. They all said I am normal, but I think I am not normal. This was her verbatim. So by listening to this, you understand what problem is actually there, you know. She may be having normal vocal folds, normal closure, normal airflow, subglottal air pressure, everything normal medically. But where is the problem? Mind is the problem. She is not happy with her voice. That is the problem. So if you go on asking the case history, okay, tell me, when did it start? Okay, do you have hoarseness, breathiness? Do you have this diet issues, or do you have this medical condition? She's going to be saying no, no, no for all. Okay, and at the end of the case history, you will be like, okay, then what is the problem? All right. So before starting these sessions to the patient, first tell the patient to tell about 10 minutes about their problem. Okay, that solves a lot of your time. That will resolve a lot of issues on their own. So you know where to treat and when to start the treatment and what level to start the treatment. Okay. So perceptual evaluation. can be done during that. You can ask her to read passage. You can ask her to say some experience sharing. You can ask her to just converse about some topic. Okay. So what I do in my patient is, tell me about yourself. That is my first thing. Tell me about yourself. What kind of a person you are? What routine do you have? What do you like? What do you don't like? Okay. So because of that, I get that knack of treating that patient very easily. So next is evaluation of other systems. Evaluation from allied health. So case history, as I discussed, these are the points. Voice care, overuse, abuse. Ironically, my voice is not good today because I've done sleepless nights last week because of a lot of meetings. So see, lack of sleep also can affect your voice, being a voice therapist myself. So previous illnesses, medication, treatments, vocal load, all that has to be asked very precisely. Only after you ask about the patient's personality. Ask about them first. Know the patient thoroughly. So then moving on to the perceptual evaluation. So you do GRBAS and there is I addition to it. Okay, now, and that itself says the instability of the voice. So you rate the voice, you do CAPE-V. I'm sure all of you are aware of CAPE-V. So Dr. Kanti, are they aware of CAPE-V? CAPE-V, they do this perceptual evaluation. Are they aware of CAPE-V? Consensus auditory perceptual evaluation of voice. I think you're mute, Dr. Kanti. You're mute.
Well, we don't use CAPE-V.
I couldn't hear you, Dr. Kanti. You are on mute.
Can you hear me, Prof?
Yeah, now I can hear you. Yeah.
Yeah. We don't use the CAPE-V. We only use the perceptual evaluation. So,
Okay, I'll explain. I'll explain about this. Yeah. Okay. So CAPE-V is more precise, they say, because they have the grading system depending on which, like suppose you hear a voice, say I say E like that, and then you take the vowels, you take these sentences, like blue spot is on the key again. How hard did he hit him? We were away a year ago. So these sentences are standardized for CAPE-V. These are 6 sentences depending on their phonetic. So see, we eat eggs every Easter is more of a vowel sentence. My mama makes lemon muffins is more of a nasal sentence. Peter will keep at the peak is more of a stop consonant sentence. We were away a year ago. It's more of a laterals like years and was. Okay. How hard did he hit him is a more of a her sentence, that is glottal sounds. These are glide sounds. The C sentence is a glide sound sentence. And the blue spot is on the key again is a voice and voiceless kind of sentence. Okay. So these sentences are prepared for voice analysis. So you have to take these 6 sentences recording with vowels, and you can also ask them to read a rainbow passage or grandfather passage or whatever for the recording, perceptual analysis, evaluation purposes. So how do we do? Once we record, we listen and we rate according to this mild, moderate and severe category. So you have to put a dot on that 10 centimeter line and actually measure the centimeters in that line. So the line is of exact 10 centimeter, visual analog scale it is called as. And the visual analog scale, you have to put a dot on where you feel the overall severity would be, then roughness, then breathiness, then strain, and then the pitch. Indicate any abnormality like lower pitch, higher pitch, by phonation or anything you want to say, even in terms of loudness. Okay. And then you have overall severity here, and the response, and you have the category like 0 to 30 is say normal, 30 to 60 is say mild, 60 to 80 is say moderate, and above 80 is say severe. So there is a category of calculating, and the average calculations are much better in this because it is actual centimeter measurements. So when you're doing research papers, correlation becomes easier. The calculation of average severity becomes very easy when you are using KP as compared to GRBS, because GRBS is a rank scale. It is a rank which you give. It's not a score actually. Okay. Here, because you're putting a dot in that visual analog, it becomes the measurement, and then it becomes the scale, which is very, very useful for the research purposes. So I would recommend you to use KP and not GRBS, or both if you're doing any research. Okay. So next, moving on to the perceptual evaluation for singers. There are many rating scales developed specifically voice handicap index for singers, where the patient is filling the information in for you about the functional, physical, and emotional aspects. And this can be done on any normal regular patient with the original of 30 questions. And that is called voice handicap index. So apart from the perceptual analysis done by the clinician, you are supposed to do the perceptual evaluation by the patient themselves. So as I told you earlier, that the patient might feel different about his or her own voice than a clinician. A clinician might feel the problem is mild, because I have seen 20 such patients, but the patient himself has not seen many. So he may feel my problem is severe. Okay. So that categorization you need to know as a therapist, so that the improvement goes in the similar yardstick. So you might feel that so much improvement has happened, but the patient might not feel it. Okay. So because of this, your yardstick should be same. And that's why you should get perceptual evaluation done by the patient as well on a regular basis, maybe every session. Next comes the functional examination. So first evaluation is the perceptual. Second comes the functional examination. So you examine the actual neck of the patient. Why you should examine, Professor Stemple has given us the guidelines very accurately, that elevated laryngeal height should be checked. Narrow tense thyroid space should be checked. Tension in suprahyoid muscles should be checked, like, this side, sternocleidomastoid, and the glottal muscles. The glossal muscles, the tongue muscles. And tightness should be checked in the floor of the mouth. And the lateralized larynx left to right, like left to right symmetry should be checked. Tension should be checked. So here the picture is showing about checking the floor of the mouth, where you palpate the base of the tongue here and check the tension. If it is too tense, if it is soft, so you have to check. Next, you have to check about the cricothyroid membrane during the pitch glides. So all of you will ask the patient to swallow. Okay, I'm showing it here on my screen. Ask the patient to swallow, then just find that cricothyroid membrane, that is a notch between the thyroid and cricoid. Okay, swallow it, find the Adam's apple, go below it, feel the thyroid ending and cricoid notch, like that membrane in between, and ask the patient to glide. Okay, ask the patient to glide and see whether that gap is increased when you increase the pitch, and whether the distance between that notch is reduced when you reduce the pitch. And this has to be done with the elevated chin. Okay, you have to look up and do it. All right, all of you can try. Look up, find the Adam's apple, just go in the straight line below, find that notch, then glide. And you can find the distance increasing, then that means it's all okay, right? So this is how you should palpate the patient and check. Next is palpation of hyoid horn, tenderness and symmetry. So if you have a nodule or a polyp on one side, the hyoid horn will be tensed and move away from the center. Okay, you will feel that the left side is more tensed and left side is swollen. You can feel that, part very easily till the level of hyoid horn. You can feel it. So some patients or some people have a habit of talking, keeping the head left side. They talk like that normally, only like that. Some people have a habit of tilting the head right, left, and sitting with the couch position, like they have this shoulder coming down, they have this sitting habits. So if I'm a IT profession and I'm looking into the laptop all the time, then my neck will be always down because I'm looking at the laptop, and I'm not keeping my laptop up. So all this has to be related with your anatomy outside, the tenderness and symmetry of the outside. So if you're keeping the, one of my patient had this, he was an IT professional. He was into a very big company, Infosys, and he was working for 8 to 12 hours a day. And he would work on a computer and he would constantly look down because he's working on a computer. And what happened due to that is he developed this shoulders and the trapezoid, they always were like this for him. And he had then started to have lowering pitch, breathiness, lot of cough, lot of throat clearing, all that. And he didn't realize because of what. After giving him therapy and his posture, looking at his posture and looking at his hyoid horn and looking at his anatomy, I could find out that the sternocleidomastoids were bulging out when he spoke. When he spoke on the neck, like this, you could see, like this, okay, the bulging out of the sternocleidomastoid. And that showed me that there's something wrong with his shoulder position. There is hypertension in the neck muscles. Okay, muscle tension was developing in the neck muscles, because of which he was having this hoarseness and breathiness. So then we worked on his shoulder position. We worked on keeping the laptop on a face level position. We made sure that I gave him some exercise to do for the spine erection and some belly breathing, and automatically his voice started changing. So I actually did not give him any traditional exercises. Okay, I didn't do breathing, I didn't do any SOVT, I didn't do any digital manipulation or massage. I didn't do any traditional therapy. I looked into the problem which is starting the voice issue. Okay, so sometimes it is not necessary that you just give all types of therapies you have read in the book. Okay, you can just know what's wrong and what is the issue with the patient and give very minimal lifestyle modifications. So what I gave him is lifestyle modifications and not the actual traditional therapy. And it worked for him without giving therapy. Okay, so it depends on what you see in the patient. So moving on, after the palpations of the muscle, you see the routine changes, lifestyle, all that you do. Then move on to the acoustic evaluation, computerized speech lab, where you will do you can do a lot. And this could be a next online guest lecture. I can talk about this for hours. Right now, we are not looking into this because we are concentrated on management. Okay. So this is what all I can do about a patient in CSL and spectrograph and phonetograph and nasometer, aerodynamic evaluations, spirometry, whether the patient has any obstructive diseases, whether the patient has any restrictive lung diseases, whether it's normal. We have to rule out all this. You might be doing PFTs regularly on the patient, I guess, and that could tell you a lot about the breathing pattern. So get those evaluations done if required from the psychologist, neurologist, dietitians, audiologists. Sometimes the patient has hearing loss, and because of which he's talking very loudly, and that goes unnoticed because it is not a visual disease, right? You can't know whether the patient has hearing loss by just looking at the patient. So any patient who is coming and talking very loudly in the clinic or in the first assessment, you should get his ears checked. Okay, especially above 40 years, I recommend all the patients of voice should get their ears tested. Okay. Gym instructors sometimes, because I had a patient who came to me with the problem of very tensed voice, suddenly throat clearing increased, suddenly coughing increased, suddenly voice went breathy, and he couldn't take out the voice at all. He went to the level of aphonia because he kept talking in that voice. So what was the problem here again? It was the gym. He was doing 2 hours of gym because he wanted to be a theater actor. So he was developing his body for acting, and then he did a lot of biceps and triceps. He lifted heavy weights, because of which again there was muscle tension in the neck. And we found that out during the history. We called the gym instructor. We told him what not to do with him. Okay, so he can do the cardio but not the weights. He can do the running and skipping, but he cannot do push-ups on the ground. These kind of changes in his lifestyle. So we need to take others into consideration, and obviously otolaryngologists, they are the first ones where the patient will go, and we all come in the secondary position, but important. So now moving on to we have now, got a very nice background on, okay, let's start voice therapy. How do you start voice therapy? It's this way. After doing all this systematically, you should take the patient for voice therapy. So as a SLP, what do I think voice therapy is going to do with my patient? Okay, so I think that my patient is having good control over their laryngeal, resonatory, and articulatory system. So my ultimate goal as a voice therapist will be not removing the vocal nodule, not reducing vocal polyp, but patient is having good laryngeal control. Patient is having good resonatory control. Patient is having good articulatory control on the system. So that is my ultimate goal. So how he uses his life, how he uses his voice in a daily life is the utmost priority for me. Okay, he should be able to use his voice as he wishes to use it. That is what is control. Okay, so when a patient comes and tells me that, madam, I want to sing, and he has vocal nodule, I definitely tell him, you can sing, but after I tell you when to. I never go and tell him, no, you can't sing, you have vocal nodule. Okay, that is not how we should tell the patients. We should tell, yes, you will be able to sing, but maybe after some time, not today, because you have nodules on your vocal fold. So I will give you that laryngeal control of singing, but when you go through these steps, okay, only then. So having the patient to, that confidence to control the laryngeal system in his body is my ultimate goal. So more frontal tone for that. So if I keep suppressing my voice inside because of some psychological issue or anatomical issue or any other issues in my life, I will never have this frontal placement, like projection from my mouth, and then I'll never, have the perfectly normal voice. So frontal placement, anyhow, you could do anatomical changes, you could do physiological changes, you could do psychological changes, you could do daily lifestyle diet changes, but have the frontal tone. So see, I'll show you what is not a frontal tone. When I speak like this, okay, my voice sounds more authoritative. I sound more firm and I sound more authoritative. But is it frontal placement? I am suppressing everything inside, right? But when I speak like this, it feels more natural. It feels more outward, right? It is coming out of my body. So the voice should be sounding like coming out of the body. Okay, it should not sound like it is going inside my body, right? So because why it is frontal? Because we speak on exhalation. When we exhale, only then voice is coming out, right? So exhalation means what? Coming out of the body, right? The breath coming out of the body. So voice also should sound like it is coming out of the body and not inside. So some of the patient, because of their occupation, because of their personality, because of their need of the hour of, somebody has to listen to them or whatever. The housewives usually on the kids, the doctors on the residents, teachers on the students, all right? And, so far and so forth, the frontal placement does not happen there. So even in our life, we should remember that the frontal placement is more natural. And when it is frontal, it is slightly nasal also. Okay, when it is frontal, it is slightly nasal. So you have to remember this. So resonatory capacities have to be used on a regular basis. So voice should be frontal and should be resonating. Okay, ringing. It should be ringing to be said as normal. Okay, so acoustically, they have to have good control over pitch with constant increase in the energy. So this is very important when it comes to singers and teachers. Okay, how? When the teachers are teaching in the classroom and you do not have good acoustic environment, especially in preschoolers, teachers with preschools, they keep shouting and screaming and singing. And what happens doing that is they lose that control over the pitch. So the pitch does not stay the same. They also increase the pitch to increase the loudness. So this is something like a singer going out of tune. So when do we say that the singer is not singing in the tune, he's singing wrong? We say that because he cannot control his pitch or the register with the increase in the loudness. Okay, so they increase the loudness and they increase the pitch. They do not, then it doesn't sound in tune. It sounds very harsh. Oh, she's shouting and screaming. Oh my God, her voice is not good at all. We feel that. Okay, but a person who actually is happy with voice therapy, when he gets control over his pitch with constant increase in the intensity. Okay, that's a difficult thing to get. Voice therapy can enhance quality of life. It can enhance the sustainability of voice. Okay, so it's just not enough if the patient improves in 4 sessions or 8 sessions and he goes home if he's not able to sustain that good voice at home. Okay, if he has to come back to you next month saying that, okay, I did not sustain, then it's not a good voice therapy. So voice therapy should aim for sustainability, that is quality of voice in his daily routine. Okay, so this is what is SLP thinks about treating a patient. Very different from an otolaryngologist, isn't it? All right, it's much deeper and in the daily life. Yeah, so what is voice therapist's job? This is voice therapist's job, and I'm happy to have found this acronym. Okay, so value your own voice through healthy diet and lifestyle. O is optimize your voice with vocal warm-ups. So every day there should be some vocal warm-up you should be doing. So today I didn't do my vocal warm-up because I had to really get up and start the session in India time. It was really early for me, almost 6:40. So I did not get time to do my vocal warm-ups, and that's why I probably have this voice issue during the presentation. Invest in your voice with training in proper techniques. So just don't Google and don't go to the YouTube. Don't see those YouTube videos and follow. You should know which YouTube video is authentic, which is giving you good information with proper technique and voice training. Cherish your voice by avoiding misuse, overuse, and abuse. So say, today my voice is not good, so I've kept the water next to me, I've kept a hot water mug next to me, I've kept a soothing factor next to me, so I'm taking care that my voice should not go bad. I should not be misusing my voice today because it's not very good today. Exercise your voice to increase endurance and power. So exercise of voice means what? So your breathing. So I said voice consists of your enhancers, articulators, your source, and your power. That is your breathing. So what you should exercise is your power, your vocal fold, your breathing, and your articulators as well. So say you have say prayer, you have prayer time. And I know that you say few lines during your prayer, and you have namaz, and you have those, kalmas to read. And if you're reading those on a daily basis in a frontal tone placement, that becomes your articulatory exercise for the day. Okay. So, for example, we have some prayers in the morning which we say to the God in Hindu tradition, where we have some shlokas which will affect on your daily usage of the voice. If you start the day with saying those shlokas, those are going to empower your throat, empower your articulators, and empower your breath. Okay, that is how the Hindu tradition of prayer starts in a daytime. Like in the morning, you should not speak a word before doing that, right? So you have those traditions in even in Indonesia, I guess, and you could follow those for a daily routine of endurance and power. So what is we? What is we? Valuing the voice means what? With a healthy diet and lifestyle. So what does it really mean? It means schedule your diet. Because of the occupational hazards, most of the vocal performers, which are level 1 and 2, that is singers, actors, theater actors, radio jockeys, and doctors, the lawyers, the politicians, are level 1 and level 2, and they often miss their meals. Okay, these all people often miss their meals because of the workload, and that makes your gut unhealthy, and that makes your voice unhealthy. Okay, so gut problems are one of the major causes of any illness in medical industry. Okay, whether it is scientifically proved now that your gut is responsible for most of the diseases. 70% of the diseases are formed because of unhealthy gut. And voice, because vagus nerve, that is also called as vagus nerve diet, by the way. Okay, healthy gut diet is also called as vagus nerve diet, because it connects your brain to your gut. It is believed in Ayurveda, it is also called as Madhya Nadi. Madhya Nadi is one of the main nerves which connects most of your body parts. Okay, that is from the brain to the gut. And that's why the gut and the diet is so very important in vocal health, and which is most of the time not looked into. I don't think in your hospital you ask about diet of the patient. Okay, but it is so very important. You should ask that in the cases. What food quantity and quality actually you have, that also matters, especially in amateur students. If your patient is a student of a college or a university, they definitely have junk food, definitely, on a daily basis. And that again goes back to the gut health issue. Okay. Next is hydration. So how much water do you drink and how much liters do you drink? That matters. So each of us have separate moisture in the skin. So depends on the age again. Children have more, middle-aged people have little lesser, old age people have even lesser. So the moisture in the skin makes a lot of difference in your moisture of your vocal fold. Your vocal fold should be moist. Why? Because it has to move like a wave. It has to move like a wave. So imagine a rubber band which is kept in a sun whole day, and you are using it in the evening. What is going to happen to that rubber band? It's going to just maybe break when you stretch it, right? So same thing happens with your vocal fold. If you're not drinking enough water, if the vocal fold is dry because of some medication, some antacids, when you give Pan-D and all, some kind of antacids to patients, it makes your vocal fold dry. So when you're giving any antacid to any patient, make sure that he's having enough hydration through his meals, okay? Because that dryness is going to cause the voice issue again. Next is protein intake. So many people in Indonesia, lucky that you guys have non-veg. There are very few who are vegetarian, pure vegetarian or vegan diets, right? So vegan is still okay, but pure vegetarian diet is not good for the protein intake. I myself am a pure vegetarian person. Sometimes, very rarely, I will eat eggs and I will not eat any meat. So what happens in a daily meal, I do not have any source for protein. Okay, I eat chapati or roti that is made up of wheat. I eat vegetables cooked in oil. I eat sometimes, I eat dal and rice, which is a source of protein actually, but I eat that very less in a daily meal, and salads. So even in salads, I don't get any protein. So what happens to me when I don't take protein whole day is my voice goes fatigued at the end of the day, because I am a voice therapist and I need to speak at least 9 hours a day. So if my vocal load is 9 hours and I don't take any protein, my voice endurance is not going to sustain. I'm going to get tired by the end of the day, which is going to reflect in my voice. Okay. So protein intake is a must. But how much protein should I have? Then people say, okay, how much do I have? Should I take protein powder? Should I eat protein powder or protein milkshake before going to the gym, which is a very common custom? So I say, how much is your weight equivalent grams you should eat? Okay, suppose my weight is 60 kgs, then I should eat at least 60 grams of protein a day. That much is the quantity. So if you have that much, only then you can sustain your voice. Okay, but some of the patients might have problems with the protein intake, so you have to be cautious, and that's why you need dietitian. For example, last week I have seen a patient with esophagotomy who has left vocal cord palsy, and he is a pure vegetarian, but he cannot take more protein because of his obviously surgical restrictions. So then he could have supplemented it with normal, and he's a vegetarian, so I can't give him meat, I can't give him anything else, even eggs, he's not eating eggs. So I can't give him lot of lentils also, because of the esophagotomy, he has lot of digestion issues. I can't give him lot of paneer. Okay, I can't give him lot of tofu and paneer. So the restriction of protein is there, and then those patients, we have to find out some other ways of developing the endurance. Okay, I'll talk about it. Next is soothing effect. So soothing effect I have kept with me today is licorice powder, or we also call in English it is licorice, and in Indian Hindi and Marathi language we call it as Jeshta Madhu. Jeshti Madhu. Okay, Jeshti Madhu is licorice powder. It's a stem of a tree which is available in powdered form, also in the stem form in India. So any Ayurvedic shop in India will have this licorice powder, or it is available on Amazon as well. So caffeinative beverages, definitely aerated beverages are vocal abuse behaviors are the red alarms. So vocal habits should be healthy. And sometimes like cheat days can be allowed 3 to 4 in a month, but not every day. Okay, 3 to 4 cheat days are allowed, but not every day. So you can have like Sundays cheat days, and the whole week you can maintain, right? So optimize your voice with vocal warm-ups. So what warm-up should I do as soon as I get up before using my voice is Omkar practice. You can also have vocal warm-up in terms of resonant voice therapy, which I'm going to talk about later. That is sustaining per swara in do, re, mi, so. In that, you have to sustain the 5th note on this out of 7. Glide up and glide down, and these can be done in humming. So it can go like either in vowel or humming, like it can go like this, or it can go like so humming, glide up, and then glide down and sustain on the same note, that is again forward focus is important, not like not like this. Can you make out the difference? The backward flow and the forward flow. This is backward, right? And can you feel the nasal? That nasal thing is forward. Okay, remember that. I'm going to teach more about this. Then the Omkar practice. O, U, are the sounds in Omkar. O, U, So it has to be like Om. Like that. Okay, one more time. Om.
Right?
Yes, yes. Okay, so humming. Then head rotation exercises. Okay, all of you can just do this to feel relaxed. Rotation of the head, left, right, side to side, up, down, and half circles. Like left to right, half circle, right to left, half circle, and backwards. Yeah. And the full body yawns, this part, I think most of the people enjoy. Like I'll show you. Like hands up in the air. Okay. Hands up in the air, legs stretch below the chair, lean on the back of the chair, and just full body stretch and yawn like a cat. Cat, how cat yawns with full body stretch. Like that. Yeah. Did you enjoy that? Did you feel fresh? Yeah, suddenly waken up from the lecture. No sleep. All right. So respiratory exercises like Bhramari Pranayam, Kapalbhati and all, we teach during vocal warm-ups, which I'm going to teach you today. Next is investing in the voice. So if I am having any of these professions, singing, acting, dubbing, radio jockey, then I'm supposed to learn the voice techniques properly. Otherwise, I'm not going to sustain. So some people are gifted, like in India, if you have heard Lata Mangeshkar, in Western, if you have heard like Michael Jackson, they are gifted people, right? But we are all not gifted. So people who are like normal like us, we should do some voice techniques every day. And this has to be given in the syllabus. So I would recommend your university to have this voice strategy techniques in your syllabus, even for doctors, because doctors also need to talk 8 hours a day, even during their educational period. So when they are actually in the semesters, first semester, second semester, they are still talking 8 hours a day and they are not following any of this, right? They are not following any of this. So you should have this in syllabus so that they learn from their basic education itself. So when they see the patient, definitely they themselves are following the rules. Okay. If I don't eat my meals from 8 a.m. to 4 p.m. and I'm telling my patient to eat, he's not going to follow it, right? So he should see me doing it, then only he's going to follow me. Cherish your voice. So don't do this, don't throat clear, don't scream and shout, don't yell. Pitch and loudness appropriately used, use of this should be appropriate according to the age and gender. So sometimes the students or the patients or especially the adolescent children try to match the pitch of their parents. The students try to match the pitch or the talking style of their teachers. By doing so, they are actually alterating the pitch, which is natural. They are alterating their natural pitch, which is, the habitual F0, habitual fundamental frequency. And that creates the problem sometimes. So you have to observe if there is any copying behavior in the patient as well. If he's copying somebody, okay, trying to be like some hero or some Bollywood, yeah. So we have had such patients who tried to be like Shah Rukh Khan, okay, but that was not their natural pitch. So that made a lot of issues with the voice. Emotional changes and muscle tension. So whether I'm depressed, I have financial issues, I have mental conditions, depression, anxiety, that may alter your fundamental frequency and may result in overuse, abuse, or misuse. So it's not only that when I talk more, it makes it voice misuse, right? if I'm depressed and I'm having pitch alterations on a daily basis, that also becomes misuse. Okay. If I'm trying to be somebody who I'm not. So for example, mimicry artist. I don't know how many people in Indonesia you find mimicry artists doing mimicry of the different actors, Bollywood actors, or, you know, different famous industry or Bollywood people in your country. I don't know how many mimicry artists are there, but in India, there are a lot of mimicry artists. So they try to take the voice out of Amitabh Bachchan, or they try to take voice out of Lata Mangeshkar or Shah Rukh Khan. So they are altering their pitch on a daily basis. That also becomes sometimes misuse. Okay. So you have to talk about those things. Stress busters in a day. So are we doing any stress buster in a day? Am I spending at least half an hour in something which I like? For example, music, dancing, maybe it's art, drawing, maybe it's just a walk in the garden, maybe just sitting with doing nothing. Okay. Or maybe it's sleeping. So am I spending that relaxation time with myself is very, very important, because again, that becomes abuse or overuse. I kept talking and talking with bad voice and without any reason. I'm just talking. There's no work. I just call my friend, I keep talking. There is no work. I just call my some of the colleagues and I keep talking. So whether am I doing that, you have to notice. Environmental factors. For example, I'm working in office where air conditioned time, most of the time I'm in the air condition. So I don't drink enough water. Okay. I'm working in an office where the building is just next to a construction site and there's a lot of dust around. I'm working in a situation where there is constant noise around me, so that I raise my loudness to reach to the people. So whether these environmental factors are causing the misuse of voice has to be checked. Okay. So that is what is cherishing your voice. So look into all this aspect, reduce whatever is not required, and make your voice very valuable. Okay. Now moving on to the exercises. So physiological voice approaches and symptomatic voice therapy approaches. Okay, so all these approaches we are going to learn today and we are going to do it practically. So physiological voice approach is having a lot of different theme and ideas. Okay, so different authors have put in different ideas into different practices. Not necessary that all the therapies will work on one patient. Okay, so what we do as a voice therapist, we use an eclectic voice therapy approach. What is eclectic voice therapy? It is mixture of what is required. Okay, so I am not going into only resonant voice therapy and not give any other things. I'm not doing only pitch lowering and not do relaxation or loudness. I'm not doing that. I'm also doing warm-ups. I'm also giving one exercise of resonant. I'm also targeting pitch raising, and I'm also doing breath support. So I'm mixing these symptomatic and physiological approaches to suit the patient's requirements. So my goal is not to give him resonant voice therapy. My goal is to make him sustain the voice in a daily life. Okay. So as a voice therapist, I will keep the patient's interest in mind first. That is my first priority. Secondary, I will think about what approaches cannot be used with him. For example, in vocal nodule patients, we cannot use push and pull exercises, this exercise, because it is going to harden the vocal fold more and increase the nodule size. So we cannot use push-pull exercises in vocal nodule patient. So I will think about those restrictions after thinking about the patient's goal. What does he need? Okay, he needs to talk 8 hours a day. Fine. So can he talk today with vocal cyst or polyp or nodule? No, today he cannot talk, but I will have that as my long-term goal that patient is going to talk after say 2 months or 3 months time. Okay. So second is I will see, okay, I cannot give him any push pull or forceful closure exercises because he has a pathology on the vocal fold. Third, I will talk about whether he has any stress or psychological issues because of which he's having this problem, or any lifestyle and diet issues because of which he's having the problem. So I will find out the root cause from his life about this voice. Why did he have vocal nodule in the first place? I'll find that out. Then mix and match these approaches to suit his needs. So I cannot give him vocal exercises to do 5 times a day because he's full-time working. Probably he's a teacher who needs to give lectures whole day, and I can't ask him to do 5 times, exercise 5 times. So I have to suit my plan. I have to make sure that my plan suits his daily needs or daily life. Otherwise, he's not going to follow the plan. If you give him unrealistic goal, he is not going to follow it. So give weekly goals, small goals, and mix and match the approaches. Don't follow. I usually don't follow a strict specific only one approach. Okay. In many other countries and in many labs, they follow that kind of approach, like following one approach only. But in Indian scenario, as far as my experience goes, it doesn't work. Okay. So you have to use eclectic voice therapy, which is a mixture of voice therapy approaches. Okay. So personal strategies, some things which I tell the patient, not indulge in unnecessary and unrealistic demands. So when patient comes to me and tells me that I have vocal nodule, the otolaryngologist has given this report and he has sent me to you for voice therapy, will I be able to talk in the meeting which I have held next week in a normal voice like the just one I had before the nodule? I very, very harshly tell him, no, you won't. Okay. So don't give him that fake demands. Don't fall for his fake demands or unrealistic demands. Tell him what is possible and what is not possible. You have to be very clear in day one. Like as a therapist, you have to tell the patient, no, you won't be able to talk normally in 1 week's time when you have bilateral vocal fold nodule. It will take 4 weeks for you to gain the normal voice. So if you keep that from the beginning, then the patient also starts following into the stepwise system. It is like a yoga. Voice therapy is like a yoga. It will not work in 1 day. It will not work in 1 week. Okay, so you have to make the patient understand that. Don't have unnecessary demands. I want to sing tomorrow. No, you can't sing tomorrow because you have vocal nodule today. So you have to make the patient realize that don't keep unrealistic demands. So work management. So if you can't sing tomorrow, how can you change your schedule? Okay, that is what you need to talk to the patient. Okay, you can't sing tomorrow. So can you postpone this particular meeting to after 4 weeks? Can you postpone this program of yours after 4 weeks? If you can, only then voice therapy will work for you. If you sing, in spite of therapists not telling you to sing, then you're not going to see the improvement in voice therapy. Regular warm-ups should be given. Vocal misuse, abuse, interaction should be done with the patient, like what all misuses he's doing. Can he use AV mode for tutoring if he's a teacher or if he's an office person where he needs to talk a lot? Can he use messages instead of talking? Can he use visual boards, sign boards instead of talking? Can he use PPT, PowerPoint more instead of talking in the classroom? So this technology-based changes in his lifestyle should be made so that he reduces his vocal load in a day. Record and play instead of, if a lecture is, suppose for example, voice therapy lecture has to be given to the students on weekly basis. So when my voice was good, I may have recorded some things. I may have had some recordings of previous patients or previous lectures. Can I play those in this week instead of talking? This kind of alteration thinking has to be given to the patient. I know that most of the otolaryngologists don't have so much time with the patient. But then you should have a voice therapist, trained voice therapist to do and spend so much time, because this requires a lot of time. Our one session with the patient is about 45 minutes. Okay. So if I see 5 patients in a day, I am exhausted. Okay. But in otolaryngology OPD, you see 15 a day. Right. But for us as a voice therapist, my maximum load of patient per day can be 8, not more than that. Okay. Because I have to talk 45 minutes for 8 patients continuously. Okay. So for me, it is more than what is, patient talks. I need to talk constantly. Patient can talk in between. So a voice therapist has 8 to 9 hours minimum of focal load, because I go home and I talk with my kid and husband also, right? So my patient 8 hours, then I go home and talk minimum 4 hours, husbands and kids required, right? So see, 12 hours if I'm talking, I definitely need to use a lot of technology based instructions to be given to my kids, or messaging my husband the daily chores, like, okay, bring these groceries, bring these vegetables, So instead of talking, I make use of messaging. So that reduces my talking at home. So all these alterations have to be suggested to the patient, because they don't realize it. We don't realize that we are talking for 8 hours. We don't realize that. Okay. Sometimes a patient is throat clearing in the clinic every 5 seconds. You won't believe it. And when I tell the patient, see, you throat cleared, see, you throat cleared. When I do that to him, he's like, oh my God, I'm doing it 100 times a day, maybe. I said, you are doing more than that, because you're doing every 5 seconds once. So this throat clearing can really have a lot of impact. So you have to do these personal workouts with the patient. This is very personal, isn't it? So what warm-up do you do? What exercise do you do? Do you walk, or do you do gym, or do you do any yoga? What do you do? So all this requires a lot of personal time with the patient. You should be his friend and not his doctor, right? Moving on to the therapeutic strategies. So first we look into hydration. Honey and Jeshta Madhu powder, which I told you, licorice powder for definitely, or Chawanprash. We get this Chawanprash also in Ayurvedic stores. I don't know about Indonesia, but in India, we have Chawanprash, licorice powder, and honey. Steam inhalation, obviously, you give to your patients. So when you should not give steam inhalation is if you have swelling and edema. Steam inhalation, you definitely should give it at least twice a day. But ask the patient to drink water immediately after steam inhalation, because steam inhalation dries up vocal folds and then throat clearing increases. So sometimes the otolaryngologist has written steam inhalation thrice a day or twice a day, and the patient is doing more, obviously, because he feels better after steam inhalation. So if the doctor is written twice, the patient is already doing 4 times. So it is harmful for the patient's vocal fold and it gets dried. So after inhalation is prescribed, you also prescribe the soothing factor. Okay, so that his vocal fold is soothed after the inhalation. And then definitely now we are moving on to the voice therapy, breath therapy, and posture therapy. Okay. So voice therapy approaches, I'm going to do a lot of things, traditional approach as well as my own what do you say? I have evolved as a therapist. I started doing voice therapy in 2003. And now after 20 years, I have evolved as a therapist. So initially when I started practicing, I would go by book, like a book has given this. These are the steps of resonant voice therapy by Professor Stemple, or these are the steps of SOVT, by Professor maybe Ingo, it is it. So I would read, I would follow the exact book steps, and I would go about it. But after practicing for so long, now I know which step to skip for which patient. Okay. So maybe initially when you start up, you may want to follow the bookish steps and go ahead. But as you learn and see the patient, you also should make notes of your own, which step was not required for which patient. Okay. So if you continue making those notes, you will know which steps are not necessary in some patients? I'm going to talk about it today so that I can give you some insight. So there are some modifications to those old traditional methods which I have developed on my own as a part of my experience. Okay, so I've taken some from the book, added some from my own experience, and made a mixture which works for my patients now. Okay, so all these exercises we are going to learn one by one. Okay, so you all are aware, and I think tongue trills, lip trills, are you aware of these? Just give me a thumbs up, or some put up in the chat. Are you aware of these techniques? Lip trills, tongue trills, voice wheels, lip buzz. Just type
We do
yes
the
or no.
exercise, Prof.
Sorry.
We will do the exercise, the lip trills, tongue trills.
Yeah, I'm asking whether you guys are knowing about these exercises.
Maybe our speech therapist. Do you know the lip trills, tongue trills? Do you use it in your therapy? In rehab medic? Lip trills, maybe like, can you show me how to do it? How to do it, maybe?
Lip trill is like this.
Oh, okay, like this. Like that.
Like that.
You do it? Dilakukan?
Lip trills.
Yeah, like that.
Okay.
Can you hear?
Yeah,
Tongue
yeah, I
trill.
can hear. Okay.
Yeah, and then, like that.
Yeah, yeah, yeah. The voice
Again.
wheels, the lip buzz,
Yeah,
the
more close with
straw
us.
technique, breath technique. Do you use all these techniques in your therapy?
This is our therapy in our hospital. This is Mr. Rizky.
Hi, hi.
Can you? Yeah, you can see it there.
Yeah,
Prof.
I can see.
Namita.
Yeah.
Yes, Prof.
Okay.
Hi, hi. So,
Yeah.
are you using all these techniques in the treating patients?
Kamu ke depan, kamu ke depan. Dek, kamu ke depan salah satu. Yuk. Yuk. Boleh, Felix, boleh. Ya. So, this is regularly, ini sering kita pakai ya di RM ya, di rehab medik ya.
Iya, iya.
Ya, always.
Beberapa teknik dilakukan.
A few. Okay. Lip trills. Ya. Tongue trills. Ya.
Tapi
Anda.
untuk kondisi-kondisi tertentu.
Oke.
Untuk kondisi kasus-kasus tertentu dilakukan.
Yeah.
Only in some special case it's done, but only just a few. It's done in this hospital, just like lip trills and tongue trills like that.
Okay, okay. Don't worry. I'm going to teach the rest of you today. All right. So I just wanted to know the baseline so that I should go how much detail. That's why I asked. So, all right. So let's move ahead. Thank you. Thank you. So let's go on for SOVT. Okay. So I have a glass with me. I'll just give me 1 second. I'll stop the background here because you won't see otherwise. Can you see my glass now?
Yeah. Yeah, Prof.
Yeah. Okay.
Yes.
So yeah, I have taken out my background. So I'm going to take some water. Okay. And also want to show some videos so it's clear. So I have two types of straws. Okay. Can you see this? Two types. This
Yes.
is, look at the diameters. I'm trying to make it closer to the camera. Can you see? Can you see?
Different size.
Yeah.
Different size.
Okay.
The small one and the second one is bigger. Okay.
Yes. So this is a normal like water bottle straw. Okay. This is the diameter water bottle straw.
Okay.
And
Okay.
this is like you use it for juice. Okay.
Okay, just straw. Yeah.
Straw. So this is a water bottle straw, little bigger water bottle inside the
Okay.
water bottle. Yeah. So when do you use these different straws? It's for the pressure building. Okay. when you have small straw, you should use this small straw, okay? And the diameter should be the big one and not the small one, okay?
Yeah.
So this is the correct size for voice therapy and not this
Oh.
one. This is not correct,
I see.
okay? So I'll again start sharing.
Is that right?
After that, I have taken half glass of water, okay? Half
Yeah.
glass. I put the straw in, I hold it, and if you see my side picture, I hold my chin up. I'm not holding it like this, okay? I'm holding the chin up position like this, normal, not elevated, just normal.
Okay, okay.
And then hold the straw with my complete lip seal. So I'm not holding in the teeth, not like this, okay? With the lips closure, full closure, okay? Take a deep breath and ask the patient to just put the bubbles in with the voice, okay? So with the voice, okay? So this is the first step, like first, yeah. Like that with the voice, and not chin down, chin up, okay? Chin up and yeah, perfect. So in this, what are we going to measure is, we are going to measure the time with which I am doing these exercises, okay? So how long I can forward that vowel or sound in the bubbles. So if I do it for 20 seconds, if I do it for 10 seconds, let's see how much I do, okay? You all count. Ready?
Yeah, ready. I can say like this. Oh.
How many seconds?
Oh my God.
30 seconds.
Yeah. So this
What
has
about
to be
20 seconds? Only 20 seconds.
30 seconds. Yeah, it is only 30 seconds. So I should be actually having around 35 to 40. Okay. So if I want to talk now, you can see the quality of my voice improved just by doing it once.
Yeah.
Yeah. So this particular exercise will give instant release, instant impact on your voice. Okay. Instantly the voice will sound more resonant, more forward. You will have less effect on your throat. Till now I was having some backlog, like back airflow log, and I was having that heaviness in my throat because of my voice condition today. But now immediately after I did it just one time, it is gone. I'm feeling more lighter. My voice is more less breathier or less hoarse, you know. So this is the impact. So let us go back to our PPT. And can you see it now? Yeah, so see the different sizes. Okay. And I told you that this is the size, the green one. Okay. You should have, and not this, the black long one. Okay. You should have this green size, or you can also have this red size. Okay. So depending on what type of patients do you have. So this straw size should be 19 to 30 centimeters. Water level should be half in the glass. If you're doing it in the bottle, also you should take it half. See, what is the difference between doing it in the bottle and doing it in the glass? It depends on how much air pressure I need to build in my subglottal air, like supraglottic region in my oromotor structure. So how much pressure is developed in supraglottic region and subglottic region, that will differ. If I take more diameter, the pressure which is required subglottic will differ. If I take less diameter, then again the pressure will differ in the subglottic region. If I'm doing with phonation and without phonation, then my supraglottic pressure will differ. Okay, if I'm doing with versus I'm just blowing the air, with the airflow difference, my supraglottic and subglottic air pressure differences will make my vocal fold close and open on its own and not with the muscle power. So why do it in water initially? Because some patients of mine were not able to do this. They were able to do, but they were not able to do. Okay. So they were not releasing the air out when they were phonating. They were not phonating on exhalation. That was the basic physiological problem. Okay. So this water bubbles is showing me whether air is coming out steadily, consistently, with same power. Okay. That is why initially take water bubbles. Then slowly you can remove the water and just have and okay, or you can also have okay. So you can have all this depending on how the patient is doing. Okay. Is that okay, Dr. Kanti? Is that understood?
Yeah.
Yeah. All right. Then straw phonation videos. Let's see.
Okay. Can we try?
Yeah. Yeah. I heard you a bit. I'll show you here. The video is much.
Can you hear me, Prof?
Yeah, now I can hear you.
Okay. Okay. So we have to do this exercise. Can we try it?
Yeah, yeah, try it.
Okay. Let me see. Oh, nothing. Okay. I'm sorry, Prof. We don't have
Okay, no
many
issues.
Prof
No
here.
issues.
It's only
No
me.
issues. We will play the video maybe. If no one is ready, we'll play the video.
Dr. Erna, do you want to try? This is our patient and our doctor from medical rehabilitation. Do you want to try?
Okay, go ahead. Go ahead.
From Dr.
Oh yeah.
Yeah. Dipin,
Yeah.
dipin.
Chin up. Chin up. Hold the glass in the hand.
Dipin.
Yeah.
Dipin. Erna.
Come
Nah.
closer to the camera. Come closer to the camera.
Erna. Yeah. Yeah.
Yeah.
Chin up.
Yeah.
Dr. Erna.
Yeah. Up. Hold it up. Chin up. Hold it up. And
Chin up.
hold. And do the blowing. Take a deep breath and start blowing with phonation. Breathe and say ooh and bubble. Okay. Breathe in. Start. Voice. Your voice is coming out? Ooh, like that? Yeah, good. Good, correct. Okay. So now let us see the video so that you can follow it much better. Can you hear and see the video? Could you hear and see it?
Not yet, Prof.
No?
Can't see the video.
On the screen, can you see the video?
Not yet, doctor.
Okay.
Oh, yeah. Yeah. Ah, you have to sit.
Diputar. Yes.
Could you hear it? This was the glide. He showed you a glide.
Can you repeat the video, Prof?
Yeah.
Okay.
This is the normal one. And this is the glide. Yeah? Okay, I'll show you. If it is not clear, I'll show you.
Can you make it bigger, Prof, for the video? Because
Okay. Okay.
cannot see clearly.
Okay, I'll show you here. This is the glide. Then this is the normal one. Okay. And the glide one. This one. Can you do that? Yes, perfect. Perfect. Okay. So longer the duration, it will be good. So I can take a long glide up and long glide down. It will be very good. If I can take short and no glide, then it will be like a middle step. So you have stepwise, like say, just blow the bubble without sound. This is first step. Second step is normal phonation. Third step is glide. Like that. Okay, so 3 steps. Did you get that? Normal blow, bubble blow with the sound, and then the glide. Okay, yeah. Moving ahead, we have different breathing exercises, which we call pranayam. Okay, prana means breath, and yam means exercise. Pranayams. Okay, so we have different 4 types of exercises. I'm going to show each one by one. We have skull shining breath. Skull shining means the breath improvises the oxygen in your brain, and that's why, like, where the knowledge is, right? So that's why it's shining. Skull shining. Okay. Bee breathing, because we hum like a bee. Alternate nostril breathing, because we breathe with alternate nostrils. And the throat locks, which are another type of breathing exercises to improve the endurance. So let's start with the first. And let's begin by, because I am not a person who is trained in yoga, I have done some courses myself, but I am not a yoga teacher. Okay, so I have given one yoga teacher from India. I have given her videos. Let us see these videos so that you understand. It's 5 to 8 minutes videos, which we all can follow. and you all can follow her and see different YouTube videos. By maybe you can also see Art of Living videos. Art of Living videos also give lot of information. So Kapalabhati, that is skull shining breath exercise. It improvises and massages and expands your brain. Okay, it is good for your brain. Increase intake capacity of lungs. It cures skin diseases. It prevents hair fall. It helps in weight loss. It improves blood circulation in the facial region as well as overall body. It improves digestion process, so gut health. It is very good for the gut health process. It strengthens your nervous system and removes body toxins. So this is good for overall health. And how it is done is slow and normal inhalation and quick and forceful exhalation. So in physiological terms, it helps in reducing your residual lung capacity. So I hope you understand what is residual lung capacity. That is, when you exhale the whole air out, you have little air remaining in your stomach. Okay, after the forceful exhalation also, you have little air remaining in your stomach. And that air goes on increasing in the stomach if we don't do active exercises. So if my job is just sitting job, then I don't do active exercises in my daily schedule. And then my belly stores more air for the residual volume, and I use very less vital capacity, which is like going out and coming in. So as the age increases, the residual capacity goes on increasing in each and every individual's body. So that's why we say that staying fit means what? Having that residual capacity to the minimum level, okay? And having more vital capacity for breathing out and breathing in. So that breathing out and breathing in air should be more than what is remaining in your stomach after exhaling, okay? So that is improved by this exercise. And let us watch this probably video. Kapalbhati Kriya. So in this video, we'll see how a big... Can you hear it?
Yes, we can hear it, doctor.
Okay, just a second. I'll just increase the volume on the laptop. Namaste. So today we are going to learn and do Kapalbhati Kriya. So in this video, we'll see how a beginner to advanced practitioners can practice Kapalbhati. So let's get started. Now, before starting, we'll look at what Kapalbhati exactly means. Kapal is the cranium or the forehead region of our brain, and Bhati means shining, also refers to perception or knowledge. Therefore, Kapalbhati means rejuvenation of our brain cells and
I'm sorry, doctor. We can't hear the voice, doctor.
you can't hear the voice? You can't hear
Yes.
it?
Yeah, we can't hear it.
It's just breath voice.
And
Oh.
relax. Now, the exhalations we did from the mouth, similarly, we'll do it from our nose. I'm going to show 3 speeds by which we can do Kapalbhati Kriya. Beginners initially can start with speed 1 and can gradually with initial.
I'm sorry, doctor, you are mute.
Yeah,
Okay.
deep inhale and exhale once. Again, inhale, exhale, and start.
Okay.
And relax.
So I'll stop share and show you how it is done myself. Okay. So you have to keep, maybe I'll go to this side. Yeah. Can you all see me now? Can you all see properly?
Yes, doctor, we can see.
But one hand on your chest, one hand on your belly. Okay. Then first forceful exhalation. Start with forceful exhalation, right? Okay. So you should feel that stomach going in. Okay. Forceful exhale. So 1, 2, 3, go. Okay. The same thing you have to do with closed mouth now. Close your mouth and you have to do that now. With the nose. Exhale through nose. Like that. Okay. So this is called Kapalbhati. So how will you hear the sound like? Like that from the nose. So what it does is reduce your tummy, your belly. Whoever has belly today, want to reduce, you should do this exercise for at least twice a day for 1 minute continuously. It is very difficult. Your abdominal muscles start paining. Okay? You cannot sustain it for 1 minute.
This is the secret of the six-pack.
Yeah, the secret of the six-pack, sitting at home on the chair. No need to go to gym. Okay? So want to develop six packs? Yes. And want to have flat belly? Yes. You have to do this.
I think but it's difficult, you know.
It is difficult. It is difficult. If you can sustain for 30 seconds, it's good. We say in Indian, Ayurveda, we say it, we have to do continuously for 3 minutes. We have to do this for 3 minutes. And 3 minutes is a very, very difficult task. It's impossible to do it on a daily basis. The people who are very physically active only can do this for 3 minutes continuously. 3 minutes continuously is like maximum you can reach. So ask patient to do it 10 times first. Don't tell him 30 seconds and 40 seconds. Just 10 repetitions. Patients should start with 10 repetitions. So just like
so we have to close our mouth.
yes. Initially, you have to tell the patient to do it with open mouth. Otherwise, it's very difficult to do it with nose.
Okay.
So initially for patient, you can say that do it with open mouth. Then once the patient is practiced, you can tell him through nose. Okay. All clear so far? Kapalbhati. Skull shining exercise. Did you feel more?
Kapalbhati. Yeah, this in Indonesia, kapala, the same.
Yeah, it's same. It's same in India. It's same in India. Kapala is this. Kapala is this, and Bhati is light. Okay, Bhati is light.
Indian language, kapala. Kapala, oh, the
Yes,
same with
yes.
us. Okay.
We say, oh, Kapala. You know, somebody does something wrong, we say, oh,
Kapala,
Kapala.
right. Kapala pusing.
Yeah. All right.
Okay. Can you do it,
So,
Erna?
yeah. So this is first exercise.
30 minutes, 3 minutes or 30 minutes?
3 minutes is like top level people. 3 minutes. Starting
3
only
minutes.
10 times. Only 10
Okay,
times.
only 10 times. Okay.
Yeah.
Only 10 times. A day. A day,
A day.
Prof.
Day.
Okay.
Okay, let's go back to the second exercise. Okay. So now next is Brahmari Pranayama. That is bee breathing. Buzz like a bee. Okay. It increases focus and concentration. It offers an opportunity to relax and bond together. It lowers the heart rate. It relieves anxiety and promotes the calm. It improvises the blood circulation in this region. It clears the sinuses because of the vibration of the skull. Okay, clearing sinuses. So if any patient has sinus issues, you should give them this exercise. Okay, let's see how it is done.
Namaste. Bhami Pranayam is very effective and it has been recommended to be practiced daily. It increases the levels of nitric oxide in our body, which helps in lowering down our blood pressure, which helps in greater levels of blood flow, oxygenated blood flow in our body, and ultimately it boosts our immune system. Therefore, it should be practiced daily by everyone. This pranayam can be practiced by everyone for all age groups. Since it affects the subtle parts or the deeper parts of our body, the vibrations which are generated through the humming sound are felt at the deeper parts of our body. There are various other benefits of this pranayam. It increases the healing capacity of the body and is recommended to be practiced after operations. It reduces the levels of stress, anxiety, and also releases the cerebral tension in our body. It helps in improving the concentration levels and also makes our memory sharp. Therefore, this pranayam has various benefits and should be practiced daily. Now, let's understand the correct technique of doing it. Sit in comfortable posture, Sukhasana, simple prostrate position, Ardha Padmasana or Padmasana, or you can even practice in Vajrasana. You can also keep a padding beneath your hip region to keep your spine erect and to stay there for a longer duration. So right now I'm practicing in Padmasana, with your head and neck erect, spine erect. Now here we need to inhale through our nose and exhale and produce a humming sound. In this manner, inhale deeply and exhale by producing a humming sound. Now this humming sound should be slow, continuous and gentle. The pitch can vary from low to medium. Initially, you can start by practicing from low pitch to medium pitch. Do not stop the practice abruptly and do not overhum. In this manner, also, while exhaling, try to pull in your abdominal region inwards so that the exhalations last longer and the vibrations are felt in whole body. Now, this practice is done in various ways. Today, I'm going to show by using Shanmukhi Mudra. Here, close your ears with your thumb. Place the thumb at the tragus cartilaginous bone present between your cheeks and your ears. Do not try to close your ears from inside. Place it gently on your tragus. Then, placing your index finger on your eyes, gently place them on your eyes. Placing the middle finger at the root of your nose.
Remove the specs.
Sides and keeping your ring finger at the upper lip and little finger at the lower lip region.
People who have
Now
specs
this is
can remove
Shanmukhi Mudra. we'll keep our elbows in line with our shoulders. From here, we'll press our ears gently so that we do not hear any sound outside. From here, we're going to inhale once from our nose and exhale and produce a humming sound.
Elbow and shoulder in one line, please. Not like this. Like this. Elbow and shoulder in one line. Yes. And then hum. Like that. Let us all do it.
Also, when we are,
Let us all do it. Okay. So the way steps are shown. Finger on the tragus. Index finger on the forehead. Middle finger below the eyes. Ring finger between the nose and the mouth. And the little finger on the chin. Don't keep hands like this. Hands like this, right? Don't keep it like this or keep it like this also. Just normal shoulder, relaxed shoulder. And there is one change from my side. Keep your tongue just behind your front teeth like this. Okay? And then close your mouth. Tongue behind your front teeth. This is the addition to what I have suggested. Okay? Close and then take a deep breath and hum. Hum. Could you do it? I didn't hear the hum. Hum and see. Did you hear the hum? Are you feeling relaxed? Are you feeling relaxed? Yeah, correct. Do it. Take a deep breath. And hum. Did you? How many seconds did you do it? Count. Number of seconds. Count. How many seconds? Count the number of seconds. How many seconds? 10, 15, 25. Very nice. Very nice. Very good. Very good. 25 is very good. All right. So this is how this particular practice is done. Let's move on to the next. Alternate nostril breathing. Okay. Alternate nostril breathing. I'll show the video and then we'll again do the exercise ourselves.
Namaste. I am Shruti and welcome to my YouTube channel, Yoga with Shruti. So today I'm here to discuss about Nadi Shodhan Pranayam. What Nadi Shodhan Pranayam is, what are its various stages, and the correct technique of doing it, what are the various benefits, and the people who should avoid doing this practice. Now, if you are new to my channel, then please hit that subscribe button and also press the bell icon for the latest videos approximately after every 1.5 to 2 hours. However, this natural rhythm can be disturbed, leading to the sympathetic and the sympathetic nervous system in our body. You should be comfortable and relaxed. You should not tense any of your muscles or tighten any of your muscles. You do not have to tilt your neck either left or right. Also, if there is tiredness in your right hand during the practice, you can hold it with your left hand in this manner. In a pranayam, there are 3 stages, Pura, Pechak and Kumbhak. The detail of this has been provided in my previous video. I will share the link in the description box. In this pranayam, we practice Kumbhak or retention. People suffering from any of the heart problems or asthma should not hold their breath, should not practice Kumbhak initially. They can practice Anulom Vilom Pranayam, the video of which has been shared on my channel. I will share the link in the description box. So initially, we'll start by equalizing our breath at the ratio of 1:1. That is, inhalation at the count of 4, and exhalation at the count of 4. Now, we do not have to simply breathe. We have to note and count our breathing so that it gets lengthened. In the second stage, we try to make.
Okay, so let me now show it what she told you. Okay, so she is going to tell you about this particular hand gesture to close the nostrils. We have to breathe from one, leave from another, and we have to hold the nostril in particular way. So this is the posture. You fold the 2 fingers and you keep the 3 fingers. And this finger together is used to close the nostril and open the nostril. Okay. So you have to start from your right press. Okay. Right side press. Leave the air from your left nostril. Leave it. And then press. Take the deep breath from the second one. Leave it. Breathe through the other. Press, leave through the left. So leaving through the left, breathing through the right. Okay. And then opposite. You can do opposite. Okay. Then again, this particular 3 finger hold. Breathing through the left. Breathe out through the right. Then again, breathe in through the right. Breathe out through the left. Breathe in through the left. Breathe out through the right. Okay, and repeat. You should repeat this at least 10 times, the 10 cycles. 1, 2, 3, like that, 10 cycles. This is called alternate nostril breathing. Okay. So this exercises improvises again the sinuses. It improvises again, it improves the people who get cough and cold very often. Okay. It reduces that. Reduces cough and cold, reduces sinus issues, reduces overall, stress and anxiety and depression on a patient. So it is overall good for breathing, sinuses, and overall blood flow in the facial region. Okay. So very good for even the patients with paralysis. Okay.
Make the exhalation.
Now, symptomatic voice technique. That is glottal closure, which is inhalation, phonation. I have shown you yawn-sai already with the cat yawn-sai posture. Okay, so inhalation, phonation, we'll learn about. You have to take the deep breath in and you have to leave the air with the phonation. First step, that is like exhale out, leave all the breath out. I'm going to stop sharing for some time. We're going to talk about inhalation, phonation. So do. This is first step. Okay, leave the breath out. The second step is breathe in through the mouth open. And then release. Again. So release. So when you are breathing in, phonate. And very normal voice, very soft nasal voice. Don't go like, don't go like that. That is wrong. Go like very soft nasal voice, like, like that. Okay. So this is inhalation, phonation. So now let us discuss which techniques are going to be useful for which of the. I've also told you the lowering pitch laryngeal neck massage, like here on the sternocleidomastoid, the neck rotation, and I've already told you that masking is nothing but the headphones where you use the masking noise and the patient speaks, used mainly for neurological ones and not for the functional ones. So which problem and what techniques are to be used? So for functional dysphonia, we will use neck and shoulder rotation, which I showed you already, remember? Then we will use head and neck positioning for vocal output. So I'll ask the patient to actually speak like that, and find out which side my voice is good, which side my voice is sounding better. I'll find out with the position of the patient, and I'll ask him to use that position for the phone calls, that position for the conversation. Suppose I find this position correct, and I'll ask patient, okay, so keep all the people to your right side and speak. Keep your head to the right side when you are talking on the phone. So find the head position for the patient and ask him to use it. Full body yawns, avoid stress, okay, and massage. So you have thyroid lamina for the massage with the 3-finger hold, just 3-finger hold. You can keep rotation anti-clockwise and clockwise, okay. For spasmodic dysphonia patient, I will not use the massage. I may use body positioning. I will avoid stress. I will ask the patient to reduce stress. Neck and shoulder relaxation massages can be given, and deep breathing can be given in spasmodic dysphonia patients, unilateral adductor or abductor type. Moving on to the voice therapy for functional disorders. For puberphonia, I will be talking about the cases, 6 cases I've got for you today. After we discuss this, I think how much time is remaining for me, Dr. Kanti?
I'm sorry, doctor.
Yeah.
Actually, we have two patients in here that have dysphonia problems.
Yeah.
Maybe we can discuss online in here to choose the best treatment for our patients.
Yeah.
Yes,
Yeah. So,
yeah.
do you want me to show the patients afterwards then, after I see online
Yeah,
patients?
maybe after the live patient, Prof.
Yeah. Sure.
So because the patient is from 6 a.m. here.
Yeah,
Okay.
yeah. Sure.
Okay.
Yeah, doctor.
Let's start with the patient.
Okay, doctor. The first one we have patient Mr. Rahim. I will try to show the slideshow, doctor.
Yeah. Namaste. Hi. So what is his problem?
Namaste, the greeting from India.
Okay. Wait a minute. Okay. Sure.
You can share the screen otherwise.
Okay, doctor. I'm sorry.
Yeah.
Okay. Can you see my?
Yes, I can see. I can see. Yeah.
Okay, doctor. The first one, Mr.
65-year-old. Yeah.
In the right side of the camera.
Okay.
He's a 65 years old man.
Okay.
This is the chronology, short chronology. In 2019, Mr. Rahimin gets stroke attack, general weakness in his right side, become dysarthria, and then have a problem of swallowing. He has come to neurologist and physiotherapists. For about 4 years, Mr. Rahim has a physiotherapist and get the general weakness become good, and then the dysarthria become better, but the sound of his vocal cord become dysphonia, and the swallowing disorder is decreasing. In 2023, he controlled to our ENT department. He had SNHL, or sensory neural hearing loss, and RSI score is 15. From the audiometry, we conclude that he has a moderate SNL and mild SNL on his in his ears. These after 4 years of stroke, he can talk, but he has a problem with his voice. Can you help us to show what is the best treatment for Mr. Rahim to get back his voice again?
Okay. Have you not done laryngoscopy yet?
Yes, we have the endoscope.
You have done. Okay.
Okay. Okay. This is the video that we had. Sorry. 2000 in.
Yeah, just show me the laryngoscopy. That's all.
Okay, wait. Okay.
Yeah.
Okay. This is the rhinoscope.
Okay. 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 Focal fold are good. The laryngeal closure is also good. It is paresis more like, looks like to me, right?
Yes, sir.
It is
Paralysis.
paresis. Yeah.
Yeah.
Yes, there is movement in area retinoid, both sides. So it's more of a recovering site. It's not remained as vocal cord paralysis now. I guess it is more of a vocal cord paresis because the area epiglottic fold is moving both sides. Yeah, yeah.
And LPR.
Yeah, yeah. Yeah, there is hypertrophy of ventricular folds. There is incomplete closure, which is anterior to posterior. Yeah, okay. He will let us begin with the therapy now. Is there any translator for me?
Yeah, we have a translator.
Yeah, you can close down the slideshow now. I can see the patient. Yeah. Yeah. So because he has vocal cord paresis and he does not have any vocal fold lesion, the vocal fold are excellent, pinkish, clear, almost the closure is near normal, little bit of closure issues are remaining. So we give him first the B breathing exercise, which I just showed you, right? So ask him to remove the specs. Remove the specs. Yeah. And follow the instructions. So keep your thumb just here, okay? Keep the thumb in your ears. Yeah. Keep the thumb in your ears. Yeah. You can ask him to do this, okay? Close the eyes. Keep the hands, elbow and shoulder in one line. Ask him to do this, okay? This line. Let him see it first. Let him see it first. Let him see it first. So this line, keep it like this. Keep the tongue behind. Like this. Tongue behind. And then like that. Close the mouth. Close the mouth. Yes. Yes, correct. Keep the hand position. Keep the tongue position. Close the eyes.
Lidahnya gini Pak, jadi kayak ngomong lam, gitu, like that, ya, seperti itu.
And close the mouth and hum. Ask him to hum.
Mulutnya ditutup ya. Ya. Sambil kayak bergumam. Gitu.
Very good. One more time. Take a deep breath and 5 times. Do it 5 times. Like that.
Gini. Nah, tapi mulutnya ditutup. Ya. Ya, gitu.
2 times, 3 times. Do it. Do it.
Ininya ya, jadi.
Do it.
Bapak ngomong. Tadi lidahnya kayak
Bisa ngerasain nggak Pak? Dengar suaranya nggak? Dengar suaranya.
Ya.
Bawa dengerin suaranya nggak?
Oke.
Coba.
Coba gitu. Bergumam gitu.
Very good. Very good. Very good. Okay, so 5 times done. So first exercise is this, doing it 5 times or 10 times twice a day.
Sampai 10 kali seperti tadi, ya. Berapa hari tadi? Sampai 10 kali.
I'll open a whiteboard and I'll write down the prescription so that you also can tell him properly. Okay, this is exercise number 1. Be breathing
Jadi nanti tak ulang lagi.
10 times morning and 10 times evening. Okay, this is the first exercise, be breathing like that. Okay, now second exercise, which is push pull exercise. Push pull exercise. Push pull exercise is, now I'm going to show him. Okay, that also is done 10 times in the morning and 10 times in the evening. This is how the prescription of voice therapy will go. Okay, the third exercise I'm going to teach him is inhale and exhale hold, that is like throat lock. Okay, these 3 exercises he has to do again 10 times in the morning, 10 times in the evening. Apart from this, he should have the diet 4 meals a day, water intake
4 kali sehari makannya.
2 liters a day,
Minumnya, ya, 2 liter.
and protein intake as much as weight. So 60 grams weight, 60 kgs weight, 60 grams protein. So as much as your weight in grams. Like you have to have protein in grams as much as your weight. So this is my prescription for him for seeing this visit. So I'm going to now teach you about the push-pull and throat lock. I have already taught you about breathing. Now push-pull and throat lock. So he has to hold the hands like this. Hold the hands like this. Fold the fingers. Hold the fingers in. Okay, hold the hand like this. This, not like this. This one. This is correct. This is correct, yeah. So, and push. Push the hand on each other very forcefully. Look up and say, E. Very good. Good voice. Better voice.
Coba sekali lagi, Pak. 1, 2, 3.
Good. Good job. So push hard, push hard. Push hard. Yeah, do you feel the change in his voice? There?
Lebih kerasa lebih keluar? Or come out? Yeah.
Yes, good. So the second technique, the second way he can do this is on the wall. I'm going to show it. I hope you can see me on the wall. Yeah?
Yeah.
So you have to make him push like this. Okay? Is there any wall in your hall? Ask him to push it on the wall like this. Okay? Okay?
Enggak kelihatan.
Yeah. So he has to go in and say E and come back. Okay? It's like push up. It's like push up. So go inside, E, and come back and breathe. Like that. Yes, very good. Go back, breathe, breathe, go back, breathe. Hold the wall. When you're coming in, you say E, and when you're going out, you say breathe. Okay? Like that.
Ini tadi sudah ditekan seperti ini, Pak. Bapak tekan ini. Bapak ngomong sambil selesai, kemudian ke belakang lagi dia. Kemudian nanti gitu lagi. Gitu ya.
Yeah. Breathe, come back. Once he finishes his breath, he has to come out, not stay there like that. See, it has to be like a push-up. See, ask him to look at me. Like that. Like that. Okay?
Langsung jadi terus lagi jadi push up-nya keluarin I-nya pas waktu lagi di bawah gitu Kak.
Pak, gini ya Pak. Yuk.
Yuk.
Yes. Very good.
Iya.
Very good.
Iya, iya.
Tangannya ya.
Very good. Very nice. Enough. Yeah. Good job. So this is the second exercise. He has to do 10 times in the morning, 10 times in the evening. Okay. Second exercise. So he can either do this way or wall push-up. Any way he can do.
Bisa yang seperti ini, bisa juga kayak yang tadi ya. Tapi yang pasti harus ada tekanan nih. Bapak kerasa ini ada rasa.
The elbow should be in the straight line. It should not be like this. It should be like this. Push hard like that. Push hard and look up, and then go for E like that.
Oh, sakit. Yeah.
Professor, he mentioned that while he was doing that exercise, it is painful in the throat.
Because he's looking like very behind. He just has to do chin up. He cannot go back. He just has to do chin up.
Ya, agak. Ini aja. Ini yang ke atas sedikit. Nah,
Hold his head. Hold his head from behind. Hold his head. That's all. Ask him to do it now.
Ya, coba sekali lagi ya. Ya. Yuk, tekan. Lurus. Tekan. Kemudian angkat sedikit kepalanya. Ya, dan diangkat. Kemudian ini sambil buat ditekan tangan kanan kirinya.
Very good. See, at the end of his breath, his voice becomes better. In the starting, it is high pitch. And then slowly, it goes better. At the end, the voice is coming better.
Okay.
Right? So slowly, when he practices, that better voice will sustain. Okay?
How long we do the evaluation of this patient?
Yeah.
How long?
This
Maybe 1 month or
1 to 2 months max. 1 to 2 months max. He will have good voice.
Okay.
He doesn't need Botox.
Better.
reducing your work.
Yeah, of course.
Yeah, all right. So the third and last therapy technique for him is throat lock. Okay. So the throat lock is you have to take a deep, first let him look at me. All of you do. Let him just look at us. Okay. All of you do, and then you teach him later on. Take a deep breath. Hold chin down and hold your breath. Don't breathe out. Take a deep breath. Hold your breath. Look down. Count to 10. Then look up and leave the air out. Okay? Again, I'll do it again. Take a deep breath. Then hold. Hold your breath. Hold your breath, chin down, and count.
3, 4, 5, 6, 7, 8, 9, 10. Kemudian
Look up and leave.
Angkat kepalanya. Keluarin ya, gitu ya Pak ya.
With the mouth.
With the mouth.
Lewat mulut. Oh, lewat mulut ya, lewat mulut. Pas buangnya lewat mulut. Ya, bernafasnya masukinnya lewat hidung, keluarinnya lewat mulut ya. Nah. Oke. 10 detik. Tahannya 10 detik. Tahannya 10 detik ya. Ya. Pas ambil nafas masih kayak gini nih. Terus di lock, dikunci 10 detik. 1, 2, 3 sampai 10, kemudian baru dilepas pakai mulut ya. Nah. Kunci ya, 10 detik. Naikkan kepala, buang dari mulut. Ya.
Yes, perfect. Perfect. Good job. Okay, so this he has to do 10 times in the morning, 10 times in the evening. Okay, and he has to do it for a week and come back to you after a week. Okay. If you think he is not able to do himself, you call him to the hospital, get it done 20 times every day, and then leave him. If you think the patient is not able to do himself at home, he is not understood, then you call him couple of times in the hospital every day, get the practice, and then ask him to do it at home for 8 days. Okay? Within 8 days, his voice will stabilize.
Menstabilkan suara dalam waktu 8 hari. 8 hari. Jadi
Okay.
Enggak bisa.
So he should be okay without Botox. He should be okay without Botox.
Ya, jadi Bapak nggak perlu dioperasi, nggak perlu diapa-apain, nanti akan bagus sendiri dengan cara tadi. Kalau Bapak merasa kayaknya saya kurang bisa nih di rumah, berarti Bapak bisa ke Mas Rizky nih. Nanti 20 kali ya dalam 8 hari nanti insya Allah akan membaik nih Pak. Moga-moga. Ya,
And
jadi
most important in this case, I think Dr. Kanti has already told, is diet and hydration. Diet and hydration. He has to eat 4 meals. He has to have a lot of water. He has to not have junk food.
What kind of diet for this patient, Prof?
Lot of green vegetables. Lot of green vegetables with meat. Meat only 2 pieces, and the full bowl 2 to 3 pieces of meat, and rest whole bowl is green vegetables.
Oke, ya. Jadi banyakin ya daging, sayur ya, buah gitu ya.
Liquid in the diet. Liquid, lot of liquids in the diet. So bowl of soup, soupy noodles with meat and vegetables, like that.
Kalau gorengan
Oily meal like fried chicken or fried.
Not allowed. Not allowed.
Oh, not allowed. Nggak boleh.
Boiled allowed.
Okay, yang direbus. Boiled.
Fried, oily, spicy, not allowed.
He really loves oily food.
That's why he's ending up with this voice. He has to change. Tell him that he has enjoyed his life and enjoyed his diet till 60 years. Now body needs something else.
Oke, dibiasakan ya Pak ya. Dibiasakan jadi ya.
Biasanya minum air es.
Oh.
Air es.
What about ice drink?
Not allowed right now. After 3 months, he can have.
3 bulan nggak boleh.
3 months.
Yeah.
So what we
I know he's sad. I know. I can see it from his face.
yes. So the recommendation is the hot water or warm water.
Normal water. Normal water.
Normal water. Okay.
Yeah.
I usually ask my patient to regularly drink warm water. So
Yeah,
I
because
got
he does not have anything on the vocal fold as such. There is no swelling, there is no thing. If he has lot of warm water, acidity will increase.
oh, okay.
Because acid in the stomach will increase with the heat.
Okay.
Yeah.
Get it. Normal water.
Yeah.
Pertanyaan Pak?
So this is my prescription. Maybe you can click a photo of this.
Yeah.
And
We already
send-
record.
Yeah. So this is my prescription for him. We have another patient, second patient number 2.
Professor, he mentioned that at night he could only sleep late. Is that okay?
No, he has to sleep 8 hours a day. He has to sleep early and he has to eat early. Before the sunset, he should eat.
Nah, dokter cerita sendiri atau gimana? Siap, aku ceritain, oke.
So 6:30 around he should eat and 8:30, 9:30 around he should sleep. For these 3 months till his voice gets better. Later on he can have, sleep little 10:30 or 11 he can have. But right now for 3 months he should sleep on time, eat on time, eat more of boiled vegetables and boiled meat and green vegetables. Okay, lot of liquid. So instead of having only salad and fried chicken, he can have chicken soupy noodle. Okay, instead of that, like that.
Thank you, Professor.
Ada lagi Pak yang mau ditanyakan? 3 bulan aja. Enggak, ini deh habit ya, tapi minimal 3 bulan itu harus dipertahankan. A lot of stress. Nggak apa-apa, ditanya.
Professor, if he has a lot of stress every day.
Yeah, this exercise is going to give him anti-anxiety and anti-stress effect. Bhramari, the bee breathing exercise is going to reduce his stress levels and anxiety.
Oh iya, nanti diajarin lagi dengan cara kayak gini nanti ya.
Okay, thank you.
I think he need a therapist because I think he cannot do it.
Yeah. It is good to advise your voice therapist can take daily sessions.
This is the therapist.
Yeah, your voice therapist can take daily sessions. He can take daily sessions. Yeah.
Thank you, Prof. And then maybe next to second patient.
Okay, doctor. And then we go to the next patient, doctor. This is Dr. Rena, 39 years old, has comes with a from the Dr. Kanti has come with an hoarseness. I will show you the share screen. At the 6th October, Dr. Anna becomes suddenly hoarseness at her voice at night, and then the 7th October become a speaker, has a hoarseness but still to speak, and then there's no pain, and after she becomes a speaker, the hoarseness becomes more severe, and she consumes methylprednisolone 16 milligram 2 times a day and gargle salt water. And then at the 8th October, the symptoms becomes more severe, and then have a cold with a green plaque, and also consume methylprednisolone, acetylcysteine, cefixime, and omeprazole. And then At the 10 until 12 October, the symptom of hoarseness still continue and coughing more frequently and have a stomach discomfort like a stomach ache and still consume methyl and omeprazole.
Okay.
And then at the 14 October, she consumed Effectrim. And then in the 23rd of October, Dr. Erna do some laryngoscope in our hospitals. We have the video.
Okay.
Cuma deh. Ini ya. Nggak bisa kan? Jadi nggak bisa muter deh.
It will play, I think. It is playing. Just give it time.
Kodeknya nggak bisa. Kalau ke Google Drive bisa langsung muncul. Nggak bisa dong. Ini nggak bisa ya. Nggak bisa ya. Yuk. Oh, oke, ini langsung ini. Oke. Oke. Dua tiga Oktober ini. Ada 20 November. Okay. This is the video of the 23rd October.
Okay. Okay. This also has acidity. Okay, there was no mass, nothing. Vocal fold is okay. There's severe acidity, I guess. Yeah. And there is absolutely no mucosal wave. Mucosal wave is absent. And there is anterior supraglottic squeeze is observed while producing the voice. Maybe that is why she's coughing a lot. Yeah. All right. All right. Can you show me one close-up shot of open vocal fold, please? One during the video. Just pause when the vocal fold is open. I want to see whether there are the finer aspects of the vocal fold. Yeah.
Okay, doctor.
Yeah. Just stop when the vocal fold is open completely. Yeah. Just pause it there. Okay. All right. All right. The edges are okay. The thickness, there's no thickness as such here, but there is slight. Has she undergone any previous, any surgeries or any medication? Any spray, mouth spray?
Never, doctor.
No. Okay. Okay. Can I now speak to her? Can I hear her voice now?
Okay.
You can stop the screen now. You can stop.
Okay, doctor.
Yeah. Yeah. Hello.
Hello.
You can speak English?
Yes, a little.
Yeah. Okay. So how are you today? Your voice is like this since how many months?
3 months.
3 months. Okay. Do you have acid reflux?
Almost 3 months.
Almost 3
Since
months.
6 October.
Okay. You have acidity coming up in the throat.
Huh?
The burning sensation coming up in the throat.
Oh,
No. But it looks like you have acidity from your vocal folds. Your meal times, can you tell me what time do you eat in a day? And how many times you eat in a day? Can you tell me that?
maybe I 3 times.
3 times. And
3 times.
what do you eat?
The first is milk and bread and rice, vegetable. I do not eat the meat.
Okay. Okay. And what is your profession? What do you do? Are you a housewife or a profession? What do you work?
Lecturer and specialist.
Okay. So you are a lecturer. Okay. So how long do you teach every day?
Not every day.
Okay. So how long? 2 hours, 3 hours, once in a week, 2 times in a week? How many?
She also the therapist, the doctor therapist.
Okay. She's also a therapist.
She is the therapist too. She is yeah.
Okay. So she gives therapy to the patients.
Physical rehabilitation doctor, specialist.
Physiotherapist. Okay, physiotherapist. Okay. So, all right.
I'm not physiotherapist, but I'm physical medicine and rehabilitation specialist.
Yeah,
Okay.
specialist.
A lot of talking is required per day. Too much talking, too much of talking whole day.
Yes, but not always.
Not always. Okay. Okay. She looks more of a muscle tension dysphonia to me. Okay. Can you show me your head position and you can show me your E sound from this position to this position like this? E. Can you show me?
Relax, Nak. Relax.
One more time, please. One more time.
Relax, relax.
Head position, yeah. Hold the mic here in your hand, hold it in your hand. Yeah, and then go like E with the mic. I can't hear your voice properly. Huh? Yes, which side do you feel voice is good? I feel your left side voice is good. Which side is good, left or right?
Wait.
Again, try again, and say E, and then say E, and say, yeah. Left side, you feel left side is good? Or right side is good?
Same.
Same? Both are same? See, your left side, your right side, and the left side. Just produce the voice, this angle and this angle. Go E, then stop, and then go E. Do it.
E.
See, your left side is better.
Okay.
Which side is better, Dr. Kanti? Left is better. Yeah. Yeah, left is better. So now I want you to put your head in the left side. Okay, put your head in your left side and then go little up, chin up, and then go E. Do it. Yeah, even better, a little better. The voice is little better here. Yeah.
Okay.
So this is your head position for phone calls, talking to the patient. Okay. So you keep your patients to your left side always when you're treating. You should speak the people like this to your left side. Okay. Shoulders should
Okay.
be straight. Turn the head to the left and little up. You should keep your head position like that, towards your left. Towards your left. Yeah, towards this side. And keep talking with the patient in that head position. So this is first exercise, head positioning. Okay. Second exercise is the bubble one, what we did. Okay. Okay. So hold half glass of water, or yeah, bottle of water, and then chin up, lip close. Like that. Do it for 10 seconds. I'll count. I can't hear your voice. Voice is coming? Voice is coming? Not able to hear you. I'm not able to hear her voice. But doctor, if you are hearing, it's fine. You can tell me the voice is coming out. Yeah. Okay. So 10 seconds. 10 seconds. Count and continue it for 10 seconds in one breath. Take a deep breath. Start. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Stop. Good. Good. Okay. Like that, you do 5 times. Now. Do 5 times now. Very good. One more time. Take a deep breath. Do it with sound. Very good. Okay. Now again say E to the left side. Say E.
E.
Better? Voice is better? You feel good? You feel good here? Yeah. So you have to do this exercise 10 times in the morning, 10 times in the evening every day. Okay. Okay. Next exercise for you is this, just with the pipe. Just with the pipe. Okay. Like that. Can you do it? Show me. Like that with the pipe. Is it paining? Is it paining here? No? Okay. Keep it down. Keep it down. Your voice is not coming out as strong as it should come in the wind right now. Okay. Without the water, it is not coming properly. So don't do this. Don't do this right now. Okay. Just do the water one 10 times. Okay. The air one we'll do later. Air one we'll do later. Okay. Now the next exercise is lip trills. And the same level. Can you do that? If you can't, then lip press. If you can't do, press your lips. Press your lips. Yeah, and do it. Yeah, press your lips hard. Press your lips hard. Like that. Yeah. Yeah, got it. Good. Good. Good, good. Okay, one more time. Very good. Okay, do it 5 times. Do it 5 times. Like that. If you can't do it only with lips, you can hold it. You can hold and press and do it. Do it 5 times. Without hold, it's not coming. Yeah, hold it. Yeah, hold it. Hold it. Yeah. No, 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 no. Hold it. Hold it. No. No, no. Say brr, brr. Got it, got it. Take a deep breath. You hold the lips. It's okay. Initially, you may have to hold the lips. Can you hold the mic a little closer? You are mute actually. That mic, you are mute on the. Can you unmute yourself?
Oh, this is using an AV from our power. So
Okay, I can't hear her at all. I am not able to hear her voice.
Okay.
Okay. Yeah. Now I can hear you. No, no. Leave the air out. Leave the air out. Okay. Not really. Not really. Can somebody teach her this? Can somebody teach her this? Holding and leaving the air through the mouth? Can you do that? Leave the air out. Is she able to do properly? Yeah.
Oh, yeah.
I'm not able to hear her. Correct. Yes. Yes. So continue this till you get it for 10 seconds. See, I'm able to do this for 10 seconds. Okay. Listen. Okay. You have to get here. So right now you are able to do only 2 seconds. Fine. Fine. Okay. Go slowly 3 seconds. Slowly, then 4 seconds. Like that. Yeah, like that. Practice. Practice for 10 days. Okay. Yeah, I got it. Good. You got it. Okay. So slowly practice. Okay. Now, if you can see, there's so much strain in your neck muscles. You see on the screen. When you do this is bulging out. Sternocleidomastoid is bulging out. So this is muscle tension. So I want you to massage your sternocleidomastoid. Okay, downwards like that. Sternocleidomastoid, downwards. This side, both sides, sternocleidomastoid, downwards, massage. Then massage your thyroid lamina. Massage your thyroid lamina. Okay. So before doing 3 exercises, I taught you 3 exercises. Okay. So those 3, before doing these 3 exercises, you should massage, you should keep your neck, little relaxed, your shoulder little relaxed, and then do these exercises daily for 10 times. Okay. And your voice should be okay on the left side. Now it should be better. Again, try left side. Speak something. Just speak, say hello, say hi.
Hello. Hello.
Yeah, better? Better?
Hello. Yes.
Yeah, good. So if you practice, your voice will be good.
Hello.
See, look at your sternocleidomastoid. It is so
Hello.
bulging. It's bulging out on the screen. If you turn and see, this is so hard. If you palpate, it is so hard and stiff, isn't it?
No spasm.
No spasm, but tension. How much is the tension? You palpate somebody else. And check yours. Some other girl in your classroom, you can palpate and check. Tension. Left side, turn your head left side and check the tension.
I don't think so.
I don't think so, Prof. No tension.
But the sternocleidomastoid is bulging out when she speaks. When she's speaking, it is bulging out. Ask her to turn the heads. Yeah. Speak and
Hello.
say.
Hello. Hello.
You feel it?
Hello.
Yeah. So when she speaks, it is getting tenser. So it is kind of muscle tension dysphonia looks like. And she's not having reflux maybe, but she still has a lot of acidity posterior side. So it's a lot of acidic food she's having probably. A lot of spice oil.
No spicy, no oily.
No oily, but then there is so much acidity I found on the posterior wall. In the vocal process, the vocal process of your vocal fold was reddish and there was a pharyngeal pouching there in your strobe and laryngoscope, which I thought. So what you need to do is monitor, go to a dietitian, get a proper diet. Energy levels of your diets are very low. Because you are vegetarian, you do not have enough protein. So start taking protein shakes. Reduce bread, reduce milk and milk products. Okay? If you're having any milk products, then reduce it.
I made
Have protein shake. Yeah.
The doctor has a protein from the white eggs, doctor. Is it enough?
Sorry, doctor has advised.
Dr. Erna get her protein from the white eggs. Is it enough, doctor?
Yes, that should be fine.
It is fine.
But eggs, if eggs in the form like lot of eggs will increase her acidity. So instead of eggs, I would recommend her whey protein or plant protein powder.
Okay. She is with GR19 diet, you know.
Okay.
From New Skin. So it always protein, right? Always protein from what?
Plant protein. She can have plant protein.
Okay.
Plant protein will not have any effect on her diet or stomach.
Daging putih. Okay. The doctor doesn't eat the red beef, but that can still eat the white beef, doctor, like a chicken, like a seafood.
Yeah. She can eat, but she doesn't eat. That's what she said. She's a vegetarian, she said.
Yeah.
So if she doesn't want to eat meat, it's fine. We can give her plant protein powder. That should be enough.
Yes, okay, thank you.
How many times she should take a meal in a day?
4.
3 or 4 times. Four
meals,
times.
4 meals with protein in the morning only.
Okay, protein.
And she should do these 3 exercises, which I've taught her to do 10 times a day in the morning and 10 times in the evening. And maybe we can just have a talk over phone. She can take my number and just talk over phone and send me voice samples of how she's recovering. Or you could do it for both the patients. I'll be happy to help.
Okay, doctor. The doctor also has a problem when she eat more raw food. It becomes stuck in her throat. Did you have any suggestion for?
Because there is muscle tension, lot of muscle tension. So let me demonstrate a technique for her. We have a specific technique of muscle tension relaxation techniques, which is also called as progressive relaxation. Okay, it is a part of a yoga meditation technique. It is called full body relaxation technique, which we do it as a part of meditation. So I'll give you a sample of just 2 minutes here. Okay, all of you, if you can switch off the lights, please, in the room. All of you switch right now. Just stop your internet or screen activities. Just close everything down. Let us have a very quiet and a normal room with no lights, not much of a light in the room. Okay. And I am going to play one nice soothing music for all of you. And you are supposed to just listen to that music, okay? And you are supposed to follow my instruction as I tell you to do, okay? So I am going to just play 1 second. Let me just start that music. 1 second. Now, there might be some advertisements because I'm playing it from YouTube, but let me just play. All of you sit relaxed, close your eyes, keep the hands on your thighs, open to the sky like this. Keep the hands on your thighs, your legs. Keep the hand on your legs, opening towards the sky. Okay? And relax. Close your eyes, relax. Take a deep breath. And breathe out. Take a deep breath in. And breathe out slowly. Feel the belly going in and out. Keep your hand on your legs, not up. Keep your hand on your legs, upwards to the sky. Close your eyes gently. Keep a smile on your face. Keep a slight smile on your face. Smile to yourself. You are a pure soul. You are a God's child. Feel good about your body. Feel blessed. Say thank you, God, for this wonderful gift and wonderful body. Take a deep breath in and relax and slowly out. Take a deep breath in again and relax. Let it go through the hands. Let all negativity in the brain go out. Let the thoughts come in. Don't stop any thoughts. Let it come in. Keep a smile on your face. Let the thoughts flow in and out. Let them just pass like all photos. All the good memories, all the bad memories. Let it just pass. Don't control. Let the control go. Let it go through the hands, out. Take a deep breath in and relax and leave out the breath. Feel the energy on your palm. Feel the energy on your palm. You may feel little heavy in the hands. Let it go out. As you breathe in, take the energy in till the top of your head. Take the breathe in, take the energy to the top of your head. And leave out. Take the breath in to the top of your head. And leave out. Now focus on the top of your head. Feel the aura. Feel your soul's aura. There is something above your head. That is your soul. Something above your head, that is your soul's energy. Feel that energy. Feel the oxygen coming in the body. Take all the energy in the body. Take the deep breath in and out. Feel the energy all around you. Feel the energy on top of your head. Take the breath in and take all energy deeper inside. Take the energy deeper inside. Slowly and steadily. Feel your body. Feel the palm. Rub your palm on each other. Rub your hands on each other. Start rubbing your hands on each other and then keep it on your eyes. And slowly and steadily open your eyes whenever you feel complete. Whenever you feel complete, slowly and steadily open your eyes. Yeah, felt good? Anybody felt asleep? Anybody fall asleep?
Almost.
Yeah, so this is called, I just gave you an example of progressive relaxation. Okay. So anybody who has stress in life, lot of stress in life, should do this for 5 minutes. You can get this on YouTube under relaxation music, relaxation, body yoga meditation. Okay, you can search under YouTube videos and you can put on any video you like and you can do it for 10 minutes a day. Before sleeping, you should do this before sleeping. You can fall into deeper sleep then. Okay.
Okay, doctor. Thank you, doctor.
Yeah. So how much time is left for me? How much time is left for me?
30 minutes again, doctor.
30 minutes. So should I present the cases which I have got now?
Okay, doctor.
Yeah.
You can show the cases, doctor.
Yeah. Okay. Just a second, I'm sharing. Okay. Let me know if you can see it. Okay. Do you want a break for 5 minutes or something, or we should continue?
Maybe
You-
break for 5 minutes
Yeah.
to the
We will-
toilet.
Yeah. 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 So I'll come back at your time is 11 something right now.
Yeah, we will back at 5 minutes again, doctor. In our time
Yeah.
is 11:45, doctor.
All right. All right.
Okay. Okay, doctor.
Okay.
Thank you, bro.
Yeah. All back?
Akhirnya 12.20. Pardon, Prof. Maybe it takes about 10 minutes again
Okay, no problem.
because we have to pray.
No problem, no problem.
Yes, thank you,
I'll be
Prof.
quick. Yeah.
Okay.
Then operated, and after a month he came to me with this. You can see the right side, little small polyp in the right side. Could you see that?
Polyp?
Yeah, the right side. If you can see here. The vocal process, it is at the inferior border, not the superior border. This here, this area, yeah. And then the therapy happened for him, and the therapy given to him was SOVT, Brahmari pranayam, deep breathing pranayam, throat lock, and diet. Lot of diet. He used to have lot of oily and spicy food and lot of talking. He used to talk with the voice which is not good, and I will make you listen to his voice pre and post. This was his post therapy third visit. After he, sorry, not this one, this one. Okay, almost reddish vocal fold, but no mass and no lesion as such. This was his last visit. He's still continuing therapy with us. So I will make you now listen to his voices. Okay, just let me stop the PPT here. I'll make you listen to his voices. The pre-therapy voice, you can hear and let me know if you can hear it.
आणि मॅडम आवाज चांगला असतो, नंतर थोडासा बसला असा वाटतो. आता
Could you hear it?
Yeah, Prof.
Yeah, and
Can
then
hear.
this was his post-therapy voice. Now I'm playing. I will play the pre-therapy one more time. I will play the pre-therapy one more time, okay?
संध्याकाळी असं आहे.
Again, I'll play. This is pre-therapy voice.
सकाळी मॅडम आवाज चांगला असतो, नंतर थोडासा बसला असा वाटतो. आता संध्याकाळी असा आहे.
Okay, slightly breathy voice. And now with the post-therapy, it is like this.
आता सकाळी आवाज क्लिअर आहे असं वाटतं मला.
Could you make out the difference? Could you make the difference out? I can't hear you.
Post therapy.
Yeah.
And now I am able to hear you, Dr. Kanti.
Okay. We
Yeah.
can hear clearly the difference, doctor.
Yeah, so there was a slight mild breathy voice because he was post-operated case already. So post-operated case will be already better in voice conditions compared to pre-operative. So he was a post-operative case, but slight mild polypish mass was developed on the right side vocal process. But later on that mass went away without surgery with therapy, and the voice quality also better. And now he's teaching at least 2 hours or 3 hours a day in his school because he's a school teacher. So I've still not allowed him to talk for 5 hours or 6 hours a day. We did SOVT, bubble exercise, we did B breathing, we did a lot of massage around the neck. Okay, so circumlaryngeal massage was used. He was given a proper lifestyle and diet. He was given the prescription of using AV mode than the chalk mode, chalk and board, blackboard mode. He used to use chalk and the blackboard, which the dust used to go in his nose, and he used to cough a lot because of that. And probably because of that, that vocal process polyp was developed. And later on, his lifestyle has changed. Now his voice has changed. Moving on to the case number 2.
The polyp is gone without the surgery, Prof?
Yeah, without surgery. Without surgery.
Without surgery. Wow. It's
Yes,
cool.
it was just by therapy. The third visit one, you can see, I'll play it again. There was no polyp at the posterior end, and it is gone with the therapy. The right side vocal fold is still reddish, but the polyp is
Here.
not there. Polyp is not there
It's
now.
the third visit.
Yeah.
How long? How month?
1 month. 1 month.
Only 1 month. Okay.
Only 1 month. Yeah. And the polyp disappeared in a month.
Wow, that's good.
So we are asking him to continue the therapy exercises at home for 1 more month and come for the follow-up.
Oh, see.
Like that. Okay. So the next case.
I'm sorry, doctor. Is there any medication that you give to the patient, doctor?
The medication was given by the otolaryngologist for the second visit, not the third visit.
Oh.
For the second visit.
Yeah.
Okay.
Third visit, he was not under any medication.
Okay. But you don't know what the medication is.
It was anti-inflammatory. Basically, I don't remember the exact names, but it was anti-inflammatory medications and acidity, anti-acidity, that is PANDI or something.
Okay, doctor. Thank you.
Yeah, and this was the MDVP pre, and this was the MDVP post. You can see in pre-MDVP, the green circle is lesser, and the post-MDVP, the green circle has increased, and now he has only problem in the intensity matters, like this jitter, relative average perturbation, pitch perturbation, soft pitch perturbation, variation in F0. Now there is no problem at all. There is no unvoicing at all. There is no degree of unvoicing at all. It is just a matter of now time that he practices, and his intensity parameters will get better. Okay, initially it was the degree of unvoicing, number of unvoicing, variation in amplitude. So this was much better, but this was much worse. The green circle was worse, but this was post-operative. This first figure is post-operative, so it is much better than the person who would have a nodule or a polyp. Okay, so this was post-operative first visit, and this was therapy last visit, third visit therapy. Okay, and I've already shown you the voices. So case study number 2. He is a 26-year-old male. He's from Jakarta, Indonesia. I took his therapy online. Okay, he was referred to me by Dr. Easy, and he had puberphonia. And there was only one laryngoscopy video, because he did not, after his voice became normal, he did not come back for the second laryngoscopy to Dr. Easy yet. He's not done it. So this was his previous video. You can see he has sulcus. Can you appreciate that? He has sulcus to the right side. He has irregular vocal fold vibration, and he has very thick vocal fold. Okay, and this was his voice. Post-therapy, you can hear the pre-therapy voice. I can play the pre-therapy voice for you as well, but I'll just have to stop share for that particular thing. I'll make you listen to his pre-therapy voice and post-therapy voice. 1 second. Yeah, let me know if you can hear it.
Hello, this is my voice before the exercise.
Could you hear it?
I'm sorry, Prof. Doesn't clear.
It's not clear, but this is what I've got.
Okay.
Hello, this is my voice before the exercise.
The intensity was not good for his voice. Intensity was not good. Okay, and now his voice is the last. I got his voice.
Hello, this is my voice after the exercise.
Did you hear it?
Yeah, we can hear it.
Yeah, so now you could appreciate the lower pitch in his voice and little bit of loudness increase. And I'll share again the post-therapy voice on the screen again.
Hello, this is my voice after the exercise.
Okay, so you could hear the voice here. High pitch, right?
Yeah.
And now this is the voice.
This is my voice after the exercise.
Okay, but the breathiness is still there, but unfortunately he did not continue therapy because he was interested only in low pitch voice. He did not continue after 4 sessions. He just left the therapy. So he did not come back, but he was keen on having low pitch voice, which he got in only 4 sessions. Okay, so that's when he left the therapy. So we don't have the post-therapy, laryngoscopy video here. So the case 3 is 19-year-old male. He was having again puberphonia, high pitch. He had this as perceptual and aerodynamic correlates, very mild breathiness in the voice, not much breathiness, but very high pitch voice. So you can hear him.
मी आता सोलापूर जिल्ह्यामध्ये राहतो, टेंभुर्णीला. मी आता 12वी मध्ये आहे. 12वी माझं नाव एकराज चोपडे आहे. काय करतो घरी? मी अजून घरी व्यवसाय ते करतो. बिझनेस आहे. इथे आवाजाचे ते बारीक आवाज होता. थेरपी करायला बारीक आवाज होता माझा. आता हळूहळू वाढलाय लागलेला आहे.
Okay, and this was his post. Now you can hear. Or sorry.
मी सोलापूर जिल्ह्यामध्ये राहतो, टेंभुर्णी येथे. मी 12वी मध्ये आहे आता. मी आवाजाचे थेरपी करतोय पुण्यामध्ये. माझा दुधाचा बिझनेस करतो मी गावामध्ये. आता माझा थोडा आवाज बदलतोय हळूहळू.
You feel the change in his voice?
Yeah, we feel the
And
change there.
can you make out how many sessions this required?
Tiga, empat.
Can you guess? Can you guess how many sessions required for this?
Three times. 3 sessions, Doctor.
3 sessions, you feel? Look at his shirt.
Oh, it seems. Is it on just only one?
It is 45 minutes. Just 45 minutes. Okay. He's on the same day. It is same shirt, same time. It's a just 45-minute session and there was this voice change. Okay. So sometimes, so which technique did I use for him? I used the digital manipulation technique. Okay. So look up, swallow, find the Adam's apple, press it little down and look down now and say E for low pitch.
Yeah, Doctor.
Yeah.
Does the results permanently, Doctor? Or
Sorry?
only?
Yeah, this voice is permanent. He didn't come back after that. He came only for one visit.
Oh, that's good.
Yeah, he came only for one visit and the voice is normal. Okay. So he was typical 19-year-old boy, not change the voice due to, you know, lot of other, maybe the shame factor here more than the physiological factor. So physiology was perfectly fine. Within 45 minutes, he could do the voice. Maybe it was more of a shame factor. That's why he was not taking that voice. When he heard his voice and I made him call his family after that. So his family did not recognize him on the phone. Yeah, so it was very nice and it was very happy moment for us. Yeah, so let's go to the next case 4. 30 years male, Marathi, English, Hindi speaking, student as an occupation, change in voice since a month or 2, and unilateral vocal cord paralysis, sudden vocal cord paralysis. There was no history of any medical, health, or any stress related issue. It was sudden paralysis. One day morning, he got up and he had a paralysis. Okay. So this rough voice, strained voice worsens during the day. A vocal load, lot of like 8 to 10 hours per day. Frequent throat clearing, pain in the throat while speaking due to strain. And he was shameful for his voice because his voice was so harsh, so very harsh that he wouldn't be able to talk in the office. He wouldn't perform in the office. He was an IT professional. I mean, he is an IT professional. And he wanted to, you know, make a good career, and he was just not able to speak in front of bosses. So it was very, very stressful mindset he had come with. And CT evidence of restricted left side vocal cord mobility, no intrinsic laryngeal abnormality seen as such. Okay. So he was not under any medication. He just was referred to me with the biphonation, very bad biphonation voice. Okay, grade 2. So this was his pre-stroke.
Even नाम का कहता थोड़ा सा के नाम नाम ये कौन होगा
See, the voice is not coming out of his throat. It was just air. It was unilateral vocal cord palsy. The conditions in the throat did not improve much post therapy. There was still a gap, but there is slighter movement in the vocal fold, which you will be able to see post therapy, and I'll make you hear his voice as well. There was still wider gap. The gap had not closed. He, in the post therapy, the gap had not closed. He had increased his air support. And this was his pre-therapy MDVP report, and which was the post therapy, the green circle. Bigger the green circle, better is the normal voice. You can see the change in his voice this particular voice is almost near normal with little bit of variation in amplitude, and if not, little bit of tremor, because he was having low confidence because of his voice, because his voice was biphonic and very, very harsh for so long that he was 2-3 months at least. So he was not having that confidence in himself. That's why probably the tremor index has come. Now I'll make you listen to his voice. I'll stop sharing. He has also given me a video, but I could not, I didn't get time to place it in the PPT, but I'll show you. Just give me 1 second. Okay, did you hear that? Such a biphonic and harsh voice. I'll make you listen to one more time.
मॅम ते ऑनलाईनच्या आर्ट ऑफ लिव्हिंगच्या कोर्सचा काय आलं का हॅपीनेस प्रोग्रामचा?
Yeah, very harsh, biphonation, not able to sustain, lot of breath. You can hear a lot of air coming out of the microphone. And now post-therapy voice. When my receptionist saw him post-therapy, she was shocked. She couldn't believe her ears. So now I'll play the second voice.
आजपेक्षा खूप चांगला आवाज आहे मला. थँक्यू.
Again, I'll play it from the beginning. So this is like when I left him last month. Okay, this post-therapy voice is recorded last month. I'll show you his.
हॅलो, गुड आफ्टरनून. आता केली एक्सरसाइज. आज परत चांगला आवाज आहे. मला टीचर वगैरे पण बोलले आज की आधीपेक्षा खूप चांगला आवाज आहे मला. थँक्यू.
So can you appreciate the change in his voice? No biphonation, clearer voice. And recently, he had sent me a video on mobile, which I couldn't transfer. Let me check if I can show you here on my WhatsApp web. Just give me 2 seconds.
Okay, doctor.
My therapist and my receptionist and other staff members could not believe the eyes and the ears that he has developed such a voice. Can you now see my WhatsApp screen?
Not yet, doctor. Yeah, we can see it.
Yeah.
हॅलो मॅम, अंकित रासकर इकडे. आणि खूप दिवसांपूर्वी तुमच्याकडे आलो होतो, 2-3 महिन्यापूर्वी लोकल कॉर्डच्या पॅरालिसिस साठी. तुम्ही नमिता जोशी मॅम कडे पाठवलं होतं. मॅमने खूप सारे एक्सरसाइजेस वगैरे दिले होते, स्टिम्युलेशन्स वगैरे केले होते. आणि आता 2-1 महिन्यात माझा आवाज पुन्हा आलाय, रेग्युलर झालाय आधीसारखा. थँक्स टू यू अँड थँक्स टू मॅम. थँक्यू सो मच.
Thank you. Okay, so did you feel the change?
Yeah, we can see and feel the change.
Happy face, very happy face.
Yeah.
He's a 26-year-old male, probably looking for a proper partner in his life. And since his voice was so bad, he was not able to get, and now he's back to his normal senses, so he was very happy. So what did we do with him as a therapy is, definitely we worked on push-pull exercises. We worked on closure exercises, that SOVT, and throat lock exercises, but we also did something new, which is called as neural stimulation. Okay, so neural stimulation was done by the physiotherapist with the galvanic electrode here placed on one of the motor neurons. Okay, just a point electrode placed on a motor neuron, and she used to give him, we did not go till Faradic, we just happened just 3 times neural stimulation, galvanic, and he was all okay within 3 weeks time. Okay, and but yes, he took a lot of time to have this voice sustainability. He took 3 weeks more time, so he came to us 2 months back. Okay, and he was having that biphonation, harsh, not able to listen to voice 2 months back. 1 month, within 3 weeks, he attained the new voice, but he was not able to sustain it. Then after a month, now you saw his video, which is sent last week to me. This was just last week video to me that, ma'am, and now I am able to sustain it. I don't need to come for therapy. Is it okay? So I said, perfectly fine. If you're fine, perfectly fine. Okay. So moving on to the case 5. A 60-year-old female, sudden loss of voice while talking, aphonia since 4 years, and provisional diagnosis was spasmodic dysphonia. She would go aphonic. Pitch breaks during phonation was very evident. Vocal load 4 hours a day, excessive throat clearing, breathing not issue. Intake of water is fine. The meals were fine. Diet was extremely okay. Nothing, no problem at all. Her pre-MDVP showed this. Definitely there was tremor index, very high frequency of tremor here. And grade 2 voice when she came to me, but when I gave her some relaxation exercises and some massages, her voice became like this. We unfortunately don't have her pre-voice, but this is her post voice. So you can see the breathiness is gone, roughness is gone, biphonation is gone. It just remain as a tremor. Okay. So it just remain as a tremor. So tremor is not going to go anywhere. It's a spasmodic dysphonia. But with the massages, the circumlaryngeal massages, and the progressive relaxation technique, which I just showed you, the meditation technique, and overall head, neck, and shoulder massage, she could sustain this minimally tremored voice and she could do her life better. She was a housewife with no extra talking. So she could sustain it just by resting in the intermittent period. Unfortunately, since the time she became better, she never came back to us. She didn't want to go for Botox. She didn't want to take any medical intervention. She was refusing any medical intervention for the same. She just came pre and we have her MDVP, but we did not record her voice because that time in the microphone, it wouldn't pick up. The voice was so bad that it was not able to pick up in the microphone itself. She was aphonic. There was no voice coming out. Okay. But after just 2 to 3 sessions, her voice became the post-therapy session and she never came back after that to us. It was just 3 sessions. I saw her only for 3 times and she never came back. But that is what the diet and lifestyle modification and voice therapy can make a difference in any individual's life. Okay, so moving back to the last case of the day. Case study 6. She is a patient of 42-year-old female. Voice change in voice since 4 months post right hemithyroidectomy. So she had right vocal cord palsy, obviously. She had aphonia for a few days, then biphonation and severe harsh voice, 6 to 7 hours per day, excessive talking, habit of throat clearing, and falsetto voice. She used to speak in falsetto voice when she came to us because otherwise the voice would not come out. And her roughness and breathiness grade 3 overall, very, very poor voice. This was her pre-video. You can hear the falsetto, very hard, breathy falsetto. And you can see that the ventricular fold was almost superimposing on the true vocal fold for the compensation. This was her post finding. So here we could not record the audio, unfortunately, in the system that time. But you can see the change in MDVP. I'll make you hear her audio voices. This was her pre. This is actually the artifacts. You see, it is not the MDVP actual recording. Okay. What you see in the left side is no recording in MDVP. There is no green at all. Right. So this is no recording. We could not, the microphone could not pick up her voice. That it was so bad. And this is her post-therapy recording, which is near normal. The biggest green circle with variation in amplitude and F naught, and little bit of pitch variation, which is absolutely normal for the right vocal cord palsy patients. I will make you listen to her voice now. You will be surprised. Again, this was a case where my whole staff got surprised. This was her pre-voice.
नमस्कार डॉक्टर. आता माझा आवाज थोडा घोगरा व कमी झाला आहे.
Okay, you can hear the biphonation and the falsetto. She was trying to take the voice out, and lot of harshness in the voice. And now her post-therapy voice you can hear.
भूर्भुवस्वः तस्य वितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्.
So she went from no voice, harsh voice, biphonation voice to singing voice now. Now she's very happy. She is a retired teacher of Sanskrit. She teaches Sanskrit to students, and now she was gone back to teaching Sanskrit again, and she was very happy soul on this earth. So yeah, this is what an SLP can do in somebody's life, with the team of otolaryngologist and physiotherapist, obviously, and dietitian. So it's not just SLP who will be working with the voice case. Voice therapy is always multidisciplinary. It cannot be just done by an voice therapist. So remember, the team has to work together to make the life change in the individuals. So thank you all. Thank you, Dr. Kanti, for calling me for this online guest lecture. And I hope you learned what you wanted me to, share. I have shared, and you are happy about today's lecture. Thank you all.
Thank you so much, Prof.Namita, for enlightening us, and we get a new insight from your presentation, of course. And it's a really, really wonderful presentation. It's very complete. I hope we can have more knowledge about it and share it in our hospital. And I like the idea that we were in the hospital or clinic, then we have to transfer our knowledge for the community by partnering with other health professionals, that this collaborating has a bigger impact for the community. Okay, is there any question from the floor? It's very clear, right? Okay.
Either it is very clear or it is gone above. Two conditions.
It's really clear. So, yeah. So there's no question, yeah. Polyp can be done without surgery. Can you see it? It's amazing. They told me, how come the polyp can be done without surgery? But this is the fact.
Yeah, no, see, it is all in your gut, as I said. So that polyp was developed because there was less moisture in the vocal fold, because the vocal fold was very dry. The vocal fold tissue was banging on each other, the vocal process. If you notice, he had a polyp on the right vocal process where there is chance of acidity soaking in, right? So acidity and the gut health was the main root cause of his problem, and I targeted that. So when I targeted that, the polyp went off. Okay, and with the therapy now, the reddishness in the vocal fold will also go slowly.
Yeah, okay. Okay, give applause first.
Thank you.
Thank you so much, Prof. Namita. Maybe we can have a quick photo.
Yeah, sure, sure.
Okay. 1, 2. Not yet? Okay. Thumb up.
Okay, done?
Yeah, done.
All right. Thank you so much for having me. Yeah.
Doctor, not yet, doctor. We will count to get the picture, doctor. I'm gonna counting to get the picture, doctor. Okay.
Okay.
3, 2, 1. Okay. Once again. 3, 2, 1. Okay. Thank you, doctor.
Thank you so much, Namita.
Thank you, Dr. Thank you.
Okay,
And have a
okay.
good day. everybody. Namaste. Have a good day.
Thank you so much.
Have a good day. Bye. Thank you so much. Thank you.
Bye. Thank you, Prof.